See you later. Okay, good evening. I'd like to call to session this August 20th meeting of the Wabash County Council. If you would please stand for prayer followed by the pledge. Heavenly Father, we just thank you for allowing us to gather here this evening and discuss many things that affects our county citizens and their lives. We just ask for your wisdom and discernment in making those decisions. Let us have foresight and look down the road for the unexpected also. With it being August and the schools starting, we just ask for additional measure of patience and blessing upon those in our kids' lives, those that are teachers, grandparents, guardians, and mentors. We just appreciate everything they give to the lives of the children, many who face struggles today that frankly our generation and generations above us didn't have to deal with. In your name, amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. As we move through the agenda items, if there's a question, concern, comment, just ask that you raise your hand. I will acknowledge you. Please state your name for the meeting minutes record, and then we'll proceed from there. First item, council members, we have is the review of the minutes from the July meeting. Is there a motion regarding that?
There's motion to approve.
Is there a second?
Second.
It's been moved by Dave, seconded by Mr. Dillon. No additions or corrections. I'll call for vote. All those in favor, please raise your right hand. Opposed, those abstaining. Motion passes 6-0 to 1. Next, we'll move into new business. Council, we have the insurance presentation. Mr. John Williams. Thank you.
Shall we get that? Is it gonna pull up or just slides?
I printed the slides for them,
Okay, perfect.
but if you want, there's an HTML with it, I think.
Thank you, everyone. Once again, my name is John Williams. I work with McGowan Insurance Group. We handle everything insurance related for the county. I have a counterpart that handles the workers' comp, liability, property, and myself, I do employee benefits. And we were just recently hired on by the county to manage the insurance related services. So coming on board, we evaluate kind of where things are today and different opportunities that we see that we can help make improvements to what is being offered to the employees from a value perspective and a cost perspective. And so before we really kind of get into the nuts and bolts of specifically the plan, I always like to do just a very high level view of the healthcare industry. And you know, healthcare, it's a very sensitive item. It is a very important item for families. And so we do have a very compassionate approach to making decisions to make sure that, number one, it doesn't have a major disruption to employee lives. So from the insurance premium perspective, regardless of a funding type, if you're a fully insured, which you pay your monthly premium to an insurance company, to a self-funded plan where you kind of take on a little bit of risk with the insurance companies, and in an effort to, if you have savings, it gets to stay with the county. So we are on a partially self-funded plan, but regardless of the funding type, 80 cents on every dollar gets allocated towards a medical claim, whether it be a office visit, a prescription, lab work, whatever. 20% is your administrative costs. That's gonna be for your third-party administrator, your stop loss premiums, care management, agent compensation. So 20% of that is administrative costs. But when we break down that 80%, where does that get allocated? So 17% is inpatient services, 32% outpatient claims, 28% is physician services, and then 21% pharmacy claims. The pharmacy aspect, that's where we're seeing the most inflation coming from. And so when we break down where these different claims are coming from, we want to make sure that we find the best solution in each one of those places. And so with the pharmacy side, we did make a change this year from Express Scripts to Smith RX. We analyzed it and saw that there was some savings to be had by changing to Smith RX from Express Scripts. And we're seeing roughly 126,000 in savings by doing that. And then employee savings, we were seeing almost 18,000. And the major difference between Express Scripts and Smith RX is Express Scripts really focuses in on rebates. You know, how much money can we get back from a prescription to kind of give back to the county? It's almost kind of like a discounting hospital. Smith RX takes a little bit different approach where they're saying we're trying to find the lowest net cost, regardless of a rebate. And so by looking at things like patient assistant programs, manufacturer coupons, international sourcing medications, so getting medications from Canada, for instance. And then we have Mark Cuban's Cost Plus program, where they're trying to get a sector of prescriptions at the lowest possible cost. So Smith RX is tapping into all these different avenues to try to find the best cost for individuals. Now, with this change, and I always say with any change, you're going to have a little bit of disruption. And so we try to minimize it as much as possible. But as a whole, it does take a little bit of steps on employees' behalf where people maybe had to change where they're getting a prescription from one pharmacy to another. But employees should have been seeing savings. And there was a little bit of noise about some prescription costing more, but then when they changed to a different pharmacy, it actually lowered what they were paying prior to with Express Scripts. So it does take a little bit of consumerism on an employee's perspective, but that's something that does need to change with everybody in the healthcare system. I always say the days of just handing your insurance card and like everything gets paid for and that's it, don't care. Really got to change. Question?
Yeah, I'm not covered under, I'm on Medicare.
Huh?
Is there a mail-in where if somebody's on a maintenance drug?
Yes. To do mail order,
They
to get a 90-day
still have
supply.
a card they can walk into the pharmacy with?
Correct. They can do it in the pharmacy or mail order for prescription. So, yep. Different avenues to go. So yeah, that's
I
still.
don't know where I heard, but I heard Smith RX was strictly mail order, so that's why I wanted to get a clarification.
No, it's not specifically
Okay.
mail order.
Thank
Now
you.
they do want to encourage people to do mail order because once again, there is that cost savings for the actual member themselves. So Smith RX takes this approach of, hey, you can go to the pharmacy every single month, but it's going to cost you more. So the encouragement is for people to do mail order, where once again, they can get a 90-day supply and they can have it delivered to their home.
Thank you.
Yep. So once again, with this transition with Smith RX, the idea is that it was going to save the county money and the employees, but having some of that little bit of disruption where it's different and getting questions answered. And we have answered a lot of questions from employees directly and worked with Smith RX Direct to make sure that employees actually were able to get the prescriptions that they need to treat conditions that they have. So this is something that we're going to be monitoring. It's a new new vendor for you guys, so we're gonna keep looking at it and making sure that the programs that they're doing are actually working the way that they should. Also, when we look at the healthcare dollar, we're looking at the network utilization and the discounts at those hospitals. So when we look at to see where is most of the care going, Parkview is where the majority of the employees are going for care. From the last couple of years, I mean, we've had 87, 92, 85% utilization at Parkview Hospital. They're right here. This is where the majority of the people are going to go. There are other hospitals that they can utilize. So you can utilize a community hospital, St. Vincent, IU, Beacon, but there's one main one that they want to exclude. And if we think about where Parkview's really located, the other big hospital system that's there, they want to avoid that hospital system, which is Lutheran. So by creating that steerage, Parkview is essentially agreeing to give their best pricing possible by saying, listen, if you come to us, we're going to give the best pricing that we're going to do. And so Signature Care, which is the network that we currently utilize for the health plan, it's basically putting a tier to say, listen, we go to Parkview, you get the best pricing.
Without checking anywhere else.
As far as
They're gonna give us the best pricing, but how do we know?
we did do just network discounts to see, like, is this actually true? And so, are you talking about just like the care for?
Yeah, I mean, I have my frustrations with the health industry to begin with, but
Mhm.
we have Parkview here and that's where everybody goes. Cause
Yeah.
there's no competition anywhere else. So if you want competition, you either have to go to Indianapolis or.
Fort Wayne, South Bend.
Yeah. So that's just my frustration. So, you're saying that you've checked that and they are getting the best pricing?
Yes, the best discounts for specifically Parkview, yes. So if we want to talk about actual physical dollars between a Parkview and say a IU or Lutheran, that takes a little bit more of a deeper dive. And so but what we're seeing is people are going to Parkview because it's here.
Correct.
We do have some steerage mechanisms, which I'll show here in a minute, to where we can get a lot lower costs. And then I have another idea too that I'd like to present to everyone that is kind of a steerage mechanism as well. But with the network discounts, this is saying, all right, with Parkview, which is the majority of where the claims are coming from, Signature Care is giving us almost a 61% discount. So Parkview is saying, you're coming here, we're going to give you the best discounts. We did do an exact repricing this past renewal cycle with United Healthcare. There was some changes that they've done with allowing people to access their networks. And so the United Healthcare network, which is Choice Plus, it was getting a 54.97% discount. By moving to the United Healthcare network, it's going to give you a broad spectrum of different hospitals that you can go to, but it was going to cost roughly $180,000 more in claims costs. So the idea was, we don't really want to go to a big broad network because we're going to lose percentage of discounts with Parkview specifically. With Blue Cross Blue Shield, this is an estimated cost, but it's about a 56% discount. And then the Freedom Network is a 46% estimated discount. And I do have a case study here too. This was the city of Fort Wayne. This was actually published in the news with Fort Wayne, where, very similar setup. They had Signature Care and then they ended up moving to PHP with their Freedom Network, which once again gives a little bit more broad access to different hospitals, but then they lost that network discount. And so once again, the majority of their claims were going to Parkview. And with that, they lost about 11% discounts. And that 11% discount equated to approximately 6.5 million in lost savings. So, this is just showing that, yes, we want to have access to every hospital, but sometimes if we kind of say, listen, if we're really kind of steering stuff towards one hospital system, that's where we're going to get the best net cost. So, Signature Care does seem to be the best value for us right now. But once again, Sam, I did say that there was some ideas that we have that we could present that could help out, which I'm going to show here in a minute. But one of them is Wellbridge Surgical Center. Wellbridge is a surgery center. It's on the northwest side of Indianapolis. Little background story: it was started by two anesthesiologists who were frustrated with the healthcare costs in the state of Indiana. They left their practice and they started this surgery center with the idea of we want fair market pricing. So it's a very nice facility. They've hit all of their quality ratings. And so this surgery center and some of these statistics on kind of their price, and then it's average Indianapolis pricing, I know. That's just something that they published on their website. Unfortunately, I don't have it in comparison to Fort Wayne, but this was just kind of a average Indianapolis, which honestly is probably not far off than Parkview, but these costs are half. And once again, the quality and the outcomes are up there as well. So Wellbridge Surgical, we have a steerage mechanism there where if you go there to get your surgery done, we waive cost share for the employee. And we're going to give a $200 gift card to incentivize them for travel expenses. So, by doing that, waiving the deductible, adding the $200 gift card, it's going to still show cost savings for the county. So utilizing a surgery center like this is very beneficial. Another thing that we did this past year is we implemented First Stop Health, which is a telemedicine benefit. Now, this isn't a major savings, but it was going to be roughly about a $10,000 savings to the county. And honestly, the member savings was more important, where it was going to save members a little over $7,000. And one thing that's really nice about First Stop Health is if an employee enrolls in coverage and it's just them as an employee only, it actually has a membership for everyone in their household. So if they have a spouse that has insurance somewhere else, children are on a different policy, they can actually access up to, I believe it's 9 people within their household to utilize this telemedicine benefit. It's at no cost. It's a subscription type service. So it's a flat per employee per month cost. But then again, it encompasses 9 people within a household. And from our rep at First Stop Health, he's even said, I have my parents on this as a person within my household. They don't live with me, but my parents are utilizing it. So it just shows that it does save the employees money, not just for them on the health plan, but their families as well. I kind of want to go back to Wellbridge Surgical. And one of the challenges that I think we have with people utilizing Wellbridge is that what surgeries do they do there? And, maybe having your Parkview physician cannot do surgeries at Wellbridge. A Parkview physician, they want to keep it within the family. They want to keep it within the walls of Parkview. And so it takes a engaged employee to say, you know what, I remember Wellbridge and I remember the costs are half, which can save the county money, which then saves, employees money on their premiums. And so when we say, how do we get people a little bit more engaged with Wellbridge? It's hard for them to remember. I mean, I'm in the business and do I know everything that they do there? No, I don't. And so an idea that I would like to kind of present is a company called Advocacy, and it's a care navigation service. Once again, people don't really know, where's the best value for care? Where's the best outcomes? Where's the cost effective places? And so this is a program where we have nurses that can do outreach calls to patients, to employees, to say, listen, we just got a prior authorization for a surgery coming through. Just gonna say knee replacement as an example. You're gonna have a knee replacement scheduled. It's at Parkview today, but we could get this done somewhere else where it's got better outcomes. And Wellbridge just might happen to be one of them. It could be another one as well. Because once again, people can utilize a St. Vincent, an IU Health, a community. But these nurse navigators, what they can do is they're using some data analytics that can show outcomes, but then also they get costs at the different facilities. And so they can make these recommendations to say, hey, if you didn't do the surgery here and did it here instead, there's a major cost savings to that, or quality, better quality at these facilities. And I like to say it's more of a white glove service, because changing from one provider, one doctor that you've seen, to go to another. All right, I've got to call this doctor, I've got to set up an appointment, I've got to, take time out of my day. That's what they do. They're the ones that are going to do the outreaches. They're going to take the doctor's notes from one doctor and give it to the other. They're the ones that are going to really kind of help move it to a different facility. And they're going to be there with that employee along the way. And so it's up to the employee. I mean, they could totally say, nope, I don't want to do this. I'm comfortable here. That's fine. That's their decision. But this is just kind of an advocate that can be on their side to say, listen, there's another place that can do this surgery and it's a lot less expensive. And so Advocacy, it is a $15 per employee per month cost, but they guarantee that and savings to the health plan. So something that we can talk about at another date, but this is an idea that we've actually inputted into our medical plan at McGowan, and the savings that we've seen has been pretty significant. And the stories, I think, are what really kind of tell the story of what they're doing. Our plan alone, we've seen about a $400,000 savings. And so that might be a little bit of an anomaly because a big portion of it was one claim. And it was something that they audited and caught an error that was done from the third-party administrator. But I do think this is a positive benefit that could be offered, and it would be something to consider on a kind of moving forward basis. I'm gonna pause. Questions, comments, concerns?
So I know that you're talking about a discount, but what about like a UCR charge? Like if this procedures should cost $100, Parkview marks it up to $1,000 and then gives you a 60% discount. That's still more than the UCR. I mean, how is that reconciled somewhere? That's what I would.
So you want to know, okay, I want the lowest net cost of a MRI.
Yeah.
An MRI, so Parkview marked it up really high, but they discounted 60%. That MRI could have been done at a imaging center somewhere else, correct?
Well, does the network hold Parkview to a UCR level charge? Like customary, it's the usual customary charge for an MRI. I mean, I know my brother had to have an MRI.
Mhm.
If he went to the hospital and did it through the insurance, it was gonna cost him $5,500.
Mhm.
He went to an imaging center and it was $500.
Right,
That makes no sense.
it is.
And it's the insurance's fault.
I would say it's a network fault, and I would say it is the
I
hospital.
mean, it's,
Well, that goes back to my point. It's like, if there's no competition between the hospitals,
Mhm.
then they're gonna charge whatever that insurance company is willing to pay.
Correct, they can, and So Matthew, that's a very, very good point, and that's where this nurse navigation can help with that. And I make the analogy, when you're in the hospital, they kind of have, it's almost like when you're at the airport, that bag of Chex Mix is $80.
Yeah.
It's ridiculous. It's criminal. You can bring a bag of Chex Mix and it's $2.
But isn't that your job to keep them in check and balanced?
With the hospital, it does, it is also the engagement of the employee. Because the hospital is gonna charge what they want for an MRI. They know that they can charge pretty much what they want.
But isn't it
That's-
your job to negotiate these prices for us?
That is a network's job to get the pricing, so the different networks negotiate those pricings. We can look at direct contracts,
Signatures.
and with direct contracts, it is mainly pulling some stuff out of the hospitals. But to get Signature Care to reduce certain pricing, as an agent, that's not something I can do.
Who does? Someone from your company had to be able to make these calls.
That is the
That's what we pay
net,
you for, right?
that is the network that does that.
So he's more of
Okay,
a
so-
broker. He's trying to shop the networks to see trends.
We find the networks, and we will look at the different networks to see the costs of, we looked at United Healthcare as the net. And the network is the one that goes to the hospitals and say, all right, we want to negotiate a price of this. So that's something that the Choice Plus network, which is the United Healthcare network. The network is the one that does the negotiating with the hospitals.
Right, and I wasn't sure this question was gonna be relative, but I have United Healthcare.
Hmm.
I have a supplement plan, and now I've gone to an Advantage plan, and because the government costs to administer the plan are so high, I have no premiums now.
Hmm.
The government gives them the money that they would spend administering my health care to United Healthcare. And not only is everything cheaper and I don't pay any premiums, they give me $60 every quarter to go buy stuff at the pharmacy. So I guess my problem is you say United Healthcare. Why aren't we signing up with one company? This looks like a monopoly. Parkview's trying to create their own monopoly to control the whole market, and our healthcare costs are out of control.
Well, that's a fact. The federal government has said Indiana's healthcare costs are exponentially higher than other states.
Right.
I mean, Parkview's one of the people that do it. I mean,
Well, I guess
they're a nonprofit, but look at all the millions, billions of dollars they've spent in the last 10 years. It's nuts. It's just.
And look
There
at
was
what
a
they're
RAND
seeing
study that
on
was
their
done.
bank account.
The RAND study was an independent study that was done on the healthcare industry, and Indiana got ranked, I want to say, second in the nation.
Yeah,
And Parkview did get a big kind of highlight of one of the more expensive hospitals in the state. Now, with that, I would say, yes, they're expensive, but some of those got skewed a little bit because it's based upon, they're basing charges on what Medicare reimburses. So Medicare is kind of a national baseline of where healthcare kind of gets reimbursed. And so Parkview specifically says, well, Medicare doesn't pay us very much. And so we're trying to supplement our operating costs with private payers, which would be people that buy insurance through employers and individually. And yes, the fact that there's not another hospital here in Wabash is a challenge. If there was another hospital right here, we'd probably be having a lot more leverage to say, listen, like, we want better deals. The networks are going to be able to get better deals, but when you don't have competition, it is harder to do that. And if we looked at the utilization and said, all right, we've got a lot more people utilizing Lutheran, then that's a whole different conversation that we could have, because historically, Lutheran does have lower net costs. And if people are willing to drive to a Lutheran facility, we'd be having a different conversation, but the fact that, you know, we've got Parkview here locally, we're kind of almost at their mercy. And so, you know, kind of going back to the question of like negotiating pricing, that's what the networks do.
But don't you negotiate with the networks?
He does.
We do not have the ability to actually, do the hospital contracting.
I do want to.
Signature Care does that.
I do want to state something. A few years ago, before we moved to, and most of you, some of you were on here. We had Anthem, Blue Cross, Blue Shield. We had them for years and years and years. And then we were talking about, that's when Anthem and Parkview kept getting into arguments and it would come down to the wire, were they going to accept them, were they? So the commissioners at that time, which McGowan was not here, asked to do a study as to how many of our employees are actually utilizing, because we had Anthem, so we could go to Lutheran, IU, what have you. How many of our employees were actually utilizing a Parkview compared to the other places? And 11 employees went to different places. Other than that, the rest of the employees went to a Parkview location. That was why the commissioners changed to Parkview Signature Care. That's all I want to say about that. Just so you kind of knew that what he's saying is actually accurate. Most of the employees.
You're open then? Or was it just
No,
the
it
clinic?
was not.
Okay, so that was before the hospital was here, that was just the walk.
Yes.
Okay, thank you.
Marcy, if you don't mind just staying up here in case there's other questions, then you're mic'd. And, for the record, Marcy Shepherd, the county coordinator who has quite a bit of knowledge and input in our health plans. So I didn't want to interrupt, but
No, the hospital contracting is done by the networks, and I do see the fact that, you know, Parkview essentially created kind of almost their own network, and they're giving themselves the best discounts. But if we would go to a Blue Cross Blue Shield, a United Healthcare, a Cigna, an Aetna, the cost would actually, I mean, the discounts wouldn't be as good. And so right now, Parkview is saying like, yes, we have this signature care network that we're heavily invested in, but we're giving ourselves essentially the best discounts. And a lot of it is just where people are utilizing their care.
So who's all in network with Signature?
Signature Care has a tiered network system. So if you're using Parkview, you have a lower deductible. If you go to there's community, there's IU, we'll actually have the facility directory right here. Cleveland Clinic. So anything that has an asterisk, I believe those are tier 1 facilities, but these are the different hospitals that people can utilize and still, you know, receive care. And, you know, once again, the discounts are there, but, you know, will someone travel to a different hospital? I don't know. We're not seeing it today. That's where maybe this mechanism of putting an advocacy could potentially help, where it's, all right, Parkview is a very expensive hospital. What if we kind of had some steers to a different hospital system that is still in a signature care network?
So I have 2 questions. One, what happens if you're in Fort Wayne and you have chest pains and the closest place is Lutheran?
Yep, great question. That was part of the healthcare reform bill, where you go to the closest facility and it's always covered as in that.
Okay, so what if you're traveling and you're in another state?
Same thing.
Closest.
Okay,
You go to the closest facility, and that was healthcare reform.
okay, thank you.
So we are analyzing the costs. We understand it is a major pain point. It's for everyone, including myself, even with our agency. And so we're trying to find value. But one of the challenges is really trying to get employee engagement. So we did host a benefits fair this year. Marcy organized a benefits fair where people could come in, ask questions, And we had an ability to try to kind of help people understand that, you know, the county, all of the employees, you're kind of in a pool together. And so all of your costs collectively together is what equates to the total healthcare spend. So if we can have some engagement and if we can have people understand that, you know, the insurance company's paying, I don't really care. That's not the right mentality to have. Like, we all have to be consumers and understand that, you know, yes, when you don't feel well and you want to just get better, a lot of times you don't care about cost, but you almost have to think about the business aspect of healthcare to say, all right, well, I can go to this facility and yeah, it is probably the most expensive, but you know, that can have an effect. But if we think a minute of, okay, well, I have a nurse advocate calling me and saying, hey, I can get this done. The quality ratings are better and it's a lower cost. That's something that we need to have employees engaged in. We had another strategy this year that we tried to implement. We did kind of a soft release on it and it was called, and this isn't in any of the information, but it was a Samaritan Fund. It's a nonprofit that can source insurance for people that have extremely high costs. And, you know, from a premium perspective and a healthcare cost for them and their families, they can source insurance in other areas for those individuals. And we tried releasing it and people just were not willing to make a change. They said that they were comfortable with the plan that they were on today. And they didn't want to make a change. And so just before Marcy and I were talking about the advocacy program, and it was one of those like, sounds great, but will people want to take the step to do it? And that's where we really do need to get people engaged, employees engaged, and at least understanding that the dollar for your health care, it does vary significantly from a provider, from getting a imaging done within a hospital versus going to a freestanding facility. We just need people to understand that there are major cost differences for that. Yes.
Okay, so there's a family plan and then there's the plan if you're a single employee. Is there an option, and forgive me, because I'm not in this plan. Is there an option within the family plan for different deductibles and amounts of coverage? When I was still working, if I could pick the family plan and I could have a $5,000 deductible or $1,000 deductible, and what I paid and what the company paid was based upon what plan I picked.
Mhm.
And same thing for single employees. They could, you know, if they're young and healthy and didn't feel like, you know, they needed to have this little tiny deductible, they were willing to take the chance, they could pay less. Is there something in this like that?
Currently, we have one plan design that we offer, and you know, since we came on board as the advisor for you guys, it was one of those, we have one plan and it seemed to be working well, but is there an ability to offer more than one plan design? Absolutely, there is.
Yeah, that's something I think we ought to look at, because not everyone needs the same
Level of
the
benefit.
same level of coverage, or some people can afford more out of pocket than others. You know, I'd like to see that kind of a presentation,
Mhm.
on what kind of money we can save. And the employees.
Being a partially self-funded plan, having another plan design, I mean, it's still a claim dollar that kind of gets put into. So, if we were on a fully insured product, that was 100% show a cost saving because of the premium reduction with a leaner plan. If we had a leaner plan and a partially self-funded basis, the county as a whole may not see a huge swing in savings, but the employees would from a premium perspective. So their cost share perspective would save there, but as a whole, I don't, we can do a study on that, but it may not tip the scale that we would want to see. But Dave, I agree, options are good. Options are good because once again, not everyone has the same need or desire for benefits.
Mr. Mize, did you have a question or?
I'm just working some numbers.
Okay, I do have a couple more questions. One would just be, is there any ability to co-op with other government entities for ourselves to save money. Have you seen that? The example is brought up to me common. Why don't you just go with the city and try to get cheaper insurance?
Mhm.
There's a lot of problems with that logistically in my mind, but I
Yeah.
don't know if there's a quick answer.
So from a co-op perspective for counties, they're not one that exists today. I have presented the idea to certain carriers because I do think that there could be some benefits to it. There are pros and cons. I've worked with them with, my prior experience. I have worked at an insurance carrier where we developed these consortiums. And it is kind of trying to get buying power. Some pros of it, it does give you a little bit of buying power, but the negative on it is that, a lot of them that have been established, it's 3-year commitments, and then if you want to leave it, because say other counties have been running really, really poorly, and it's affecting, this one specifically, you have to give a 6-month notice, and then once again, you have that 3-year commitment. So sometimes you almost get handcuffed in those types of arrangements. But, understanding the law of large numbers, it can help. But a lot of times, people are kind of protective of their own population.
And my second follow-up question is, I've been told multiple times, moving away from a partially funded, self-funded plan to where it's completely, I don't know the correct terminology, but a traditional plan where we're just paying the premiums, we're not self-funded and self-insured at all. I've always been told that's way more expensive, that's way more expensive. I've never heard that quantified, what way more expensive is. So for example, if we were to say our family plan runs 28,000 per premium, where would you place a non-self-funded plan? In your opinion, I'm not gonna hold you to it.
No, and we're kind of almost comparing apples to oranges with, the funding arrangements. The idea with a partially self-funded plan is that when we have those good years, that money stays within the county, whereas a fully insured plan, you pay that money to the carrier, and if that carrier happens to, your claims are a lot less, money stays with the carrier versus, you have the ability to keep that money when you have those good years. Because you're gonna have good years and you're gonna have bad years. And, in a partially self-funded plan, if you're running well, 2 out of 5 years, you're winning. Now the goal is to do better.
Marcy, do you feel like we run well 2 out of 5 years?
I'd say yes. I would actually say yes.
And if we were on a plan where we were just paying the premiums, would that make it easier to give the employees option on the level of coverage that they wanted to pick?
We can do it either or.
Or you can do it either way.
Yeah, you can have more than one plan design on a self-funded plan, yes.
Okay.
So, on a self-funded plan, the savings would be probably more on the employee on their cost shares versus really the overall healthcare dollar that, the county is spending. But now, on the flip side, if you were on a, fully insured type plan where you're paying your monthly premium every month to the carrier, that's where, you could see a potential little cost savings. But kind of once again, in a fully insured world, it's one of those, when you have good years, you get to keep the money versus the carrier doing it. You're betting on yourself versus just kind of letting the carrier gamble with your money.
Well, I'm gonna do something that's a little bit out of sorts here, because we got some employees sitting in a room, just a simple show of hands. How many people would like to have the option of selecting different levels of coverage with different levels of deductibles or max out of pocket? If you'd like to see that, put your hand up.
Yeah,
Huh?
if I see it, that doesn't mean I want it.
Well, yeah, I'm just saying, do you want to see it?
See it.
I mean, I don't want to go prepared if you guys aren't interested in looking at it. Looks like you don't want to see it.
Options are good, and I would agree with you that, offering another plan design is 100% easily able to do, so. Yes,
There's gotta be an incentive there, Dave.
Well, it is, they're gonna save money.
I don't think so. The plan options would be a high deductible option, which means they're more out of pocket. Their premium that we're taking from them already, or their sharing, is a fraction of the total premium. We're averaging $14,500 per employee if it's 110. How many employees we got?
Around 116, I think.
Okay, I used 110, so these numbers are a little skewed, but so our total premium is 14,500 based on what we paid last year. And the an individual is only contributing 1,200 of that. So that's $13,000. The only savings is going to be on the county, which doesn't help the employee.
No.
Because the premium may go down because whenever you increase that deductible, you're taking on the risk that the insurance company isn't. And the only way that savings is gonna come is in that premium. Now, I'm sure with the self-funded kind of hybrid, it's a little different matrix, but I don't think the employee is gonna save if we add a high deductible option. The county might, because I wouldn't suggest changing these amounts. Again, they're already, I think, at low levels. I know that if we raise that $10, there's a shitstorm, but it's, those are cheap rates, I'm telling you right now.
I think a lot of our insurance, where you hear a lot of complaints from, with the employees is, I think it's more education. I think that the employees could help themselves tremendously, one, by utilizing the first stop. Instead of going to the ER, here, call this doctor. And I think it goes back to a lot of education of, instead of going to the ER where it's gonna cost you $500 out of your pocket, go to teledoctors, they're not gonna cost them anything. But if you go to
Urgent care.
yes, an urgent care, it's gonna cost you $50. And it's just a matter of getting the employees to understand it hits their pocketbook as well as the county's. But theirs is what, if they realize that eventually, if they're going to the 50s, it's gonna come down in their premium. Their premiums could be stagnant.
Good
But-
information.
Again, that goes back on the education to the employees.
Well, I think so. And again, I'm not an employee of the county, so I don't see what's put out there and what they're seeing, but certainly you're saying Lutheran is cheaper even though we're on a Parkview network? If you're gonna charge $1,000 for something and Parkview's gonna give you a 60% discount, but Lutheran's gonna charge you 600 and give you a 50% discount. Yes, the discount is less, but the charge for the procedure is way less. So the net to the cost of that procedure is less.
Correct.
And are you saying that this advocate care, this nurse person, are they gonna do some of that before they call the employee and say, hey, we know that you're wanting to do this. We've looked at the different facilities. We looked at the different options. Even though it's not a Parkview facility, you're gonna do better out of your pocket. Now, we don't wanna send them to some
No.
crappy healthcare place, right? But
There's quality aspects of it that are analyzed because readmission rates is a major component of it. And I can raise my hand of a readmission rate and it's like, that was 2 surgeries, that should have been 1. And kind of going back between a Lutheran and a Parkview or any other facility is that we look at the utilization and the utilization is coming to Parkview.
well, it's because
It's right
the
here.
options are limited.
Yeah. If we were to say, let's exclude Parkview and go other places, it's not gonna probably go well for the employees. So I understand. like,
Does that service do some of that? Will they look outside of Parkview?
Yes, they do. Yes.
Okay,
So like,
that's-
for instance, Wellbridge Surgical, it is one of those things where, hey, I uncovered a prior authorization that came through. I'm gonna do an outreach to this employee and educate them about that service there, about that facility. And not only just educate them about it, but let me help you get an appointment there and introduce you to the physicians that do surgeries there, because there are multiple different specialists that can do surgeries there. And help them even set appointments. So it is one of those things where they're trying to find those better providers and lower costs.
And is there a cost to adding this function to our are,
Yes, I believe it
$15
was
per employee, didn't you say?
$15 per employee per month, but they guarantee that cost too, that they see that the savings. So when we look at kind of the total spend, it's probably a pretty nominal cost in the whole grand scheme of things. And if we can get enough surgeries to go through a different facility by creating a steerage, because once again, most people have probably a Parkview primary care physician, or they're seeing a Parkview specialist. Well, if you're a Parkview physician, they want to keep it within the family. They want to keep it within the walls there. It's kind of going back to the whole, you're buying checks mix at the airport. You're on the walls of the airport. But if we can somehow have that informative information to say, we can have it done somewhere else. And as long as we can get employees that are willing to make those decisions of maybe changing where they're getting certain services done, specifically on surgeries, it can have a very impactful effect on claims.
How easy is it to transfer your medical records from a Parkview to this place? Like, or do they have to go through the whole, explaining their condition again? I mean,
No, that's where the nurse advocate steps in.
Okay.
And they actually help, because once again, as a average consumer of healthcare, it's not always that easy. And that's why, most people will just kind of continue the path that they're
I'm
on.
gonna go through the pain in the butt of getting all the records, doing this. Yes, I already told 8 doctors that my elbow hurts when I do this.
Yeah.
Yeah, I mean.
Correct. And that's where we're kind of having that, I'll say, white glove service of a nurse practitioner that knows the healthcare industry, knows what to say. And I need these files from the current provider. And then, we have these other facilities. Let's talk about them. Let's get you comfortable with maybe a different provider.
I think it goes to educating the employee on trying to make it the best overall. Obviously, we want good healthcare, but it's just, I mean, it's costing us $1.5 million every year. I mean,
It's one of those things where we're trying
well,
to find.
plus if we had the 500,000 that we pay for jail care, can we put them on the policy? No, like, in all seriousness, what if we had our own clinic? What would that do? If we had a clinic with a nurse practitioner and a couple nurses in there?
We've talked about that and, to start a clinic and actually, Parkview is opening up a clinic.
Oh, of course. That makes sense, yeah.
Independents, they do work.
My wife's insurance policy or insurance plan has 2 or 3 clinics now. I mean, they're growing.
Marathon Health.
It's a school, it's a public school,
So-
Eastbrook, and there's like 5 schools in it now.
Mhm.
I mean, it's growing, but
I have a school system that I work with where they have a near site clinic that they can go to and they pay almost like a subscription to it per employee per month. And they do have their smaller claims are definitely a lot less because people are utilizing the clinic. The major claims, the big stuff, that's the things that really cause the big costs. Those are the things that we really do need to probably address because those are the big ticket items. But yes, clinics do work on the smaller stuff from a prescription basis, but it is getting someone to kind of have a clinic here, which, talking to, there are companies that set up clinics, whether it be a dedicated one just solely for county employees, or it's a shared clinic where, multiple different employers come together and say, all right, we'll share these resources together.
I think we have a couple of big employers in the community that could probably do something now. I mean,
It can, and
We got a building in just
partner with them. Where do they go? They have
They have it in now.
there is a lot of
close to the jail.
startup costs.
No, like just for the jail medical, we pay half $500,000. $500,000 to take care of criminals.
I don't want their.
Can you quote that one too?
Well,
Can you quote that one too?
I can definitely look at it to see. I mean, there's a creative solution. I explore them.
yeah, and that's all we're looking for is a way to still provide good care, but not at these numbers. It's just,
It's hard for not just Wabash County, it's hard for lots of employers. I see it on a day-to-day basis. I feel like the Grim Reaper a lot of times. And it is a challenging industry. It really does drain on my heart because I look people in their eyes and it's like, our costs are going up. What can we do to try to lower them? And we're heavily involved in a national association of brokerage firms that we get together 3 times a year to discuss and try to find different solutions out there that can help lower these gross costs, because it is a runaway train and it is frustrating. I always say it's expensive, it's a foreign language. There's just, people need to have a little bit more education on kind of how to utilize healthcare, because we're all being taken advantage of. And, you know, hospitals want to get paid more, insurance companies want to get paid more, and it comes out of our pockets for that care. You know, we talked about prescriptions, new medications that are coming to the market. They're life changing, but at a cost of, on average, $4,000 a month for these prescriptions. And that is a very challenging thing to try to overcome, because these new medications come to market and people are going to take them. They see the commercials for them, which is a whole nother thing that we could probably talk about after.
Don't get me started.
Me neither. How late do you guys want to be here?
They're gonna be here late tonight.
It's frustrating.
I have a
And
question.
we need to try to find those avenues of sourcing medications in different fashions, because we know that someone's gonna take it. But can we get it at a lower cost in the different avenues? So like going back to the manufacturing costs, there are patient assistant programs, which is a whole nother thing. International sourcing, getting them from other countries, which is
oh, I did that.
ridiculous.
There was one medication, it was $570 a month.
Mhm,
I got it from Canada for $272 for 3 months.
mhm.
It's a fraction, it's
Yeah.
20%.
And to have a company like Smith RX doing this for us and doing this for employees, you know, they're taking kind of the legwork and doing it for them. I mean, that's what we're really trying to find, these savings of how we can really control some of these costs. So,
Dave had a question and then I'll kind of be
Yeah.
wrapping up here.
Matt mentioned it, you mentioned it, Marcy mentioned it. Did you offer this education for employees? Cause we got half a dozen places where we could put on classes for the employees to help manage this.
I do. And that was one thing that we did a health fair this year, where, you know, we allowed,
When do we re-enroll in their benefits? I mean, does it change every year? Do they have?
October, everybody.
Is it in March?
we're,
Health insurance.
So maybe in February. you come in-
Well, that's what we did. When I did the health fair, it wasn't just our health insurance. I mean, I had representatives from PERF, representatives
So
from
you
Boston
do it,
Mutual. I'm trying to decide because I didn't have a real good turnout.
Make it
I
mandatory.
had,
Yeah,
then you guys are the ones that have to tell me it's mandatory. I don't have the authority.
They gotta do that.
But we had, I mean, I would have liked to have had more people, but you know, the year before we did employee meetings and we had a fantastic turnout. Other than 2 departments.
we spent about 3 days.
We spent 3 exhausting days going around, so we were the ones that were moving around, so the employees didn't have to. But we had a fantastic turnout. I did just do recently a seminar on, what did I do that on? What was that on? Carol, what did I do that on?
You did life insurance.
Like, was it life insurance? No.
No, it's social security.
It was Medicaid. It was Medicaid, okay. Just did a Medicaid seminar for employees that are kind of reaching. Well, then a couple employees said, can we do social security? So I'm working on doing a social security one. I've had another employee say, but can we do PERF? So the education is slowly getting out there, but like I said, I'm one person, so.
No, you're right. Education is important. And I do, with all of my clients, that is something that I really think is important to do, because once again, you have employees that have a card and It is almost unlimited. But if we can teach people how to use that card a little bit more effectively, collectively as a group, it can help control costs.
I would be able to do that.
I appreciate your time, seeing John coming
Thank
to speak
you.
with us, Marcy also for being called up here, out of the blue. I don't currently have any other questions. Do you have anything to leave us with? I didn't want to interrupt. We're good.
I think we
We're good.
covered it all, and like I said, with the new program, if we need more information, and I'd be happy to bring one of the nurses actually up here to meet. And she can tell the stories. I think that would be a very positive item.
Appreciate your time.
Thank you,
Thank
guys.
you.
I appreciate
Thank you.
you.
Thanks.
Thanks for answering our questions.
Absolutely.
Council, the next item on our agenda is the appointment of the MUST Committee representative. I'll turn the floor over to the auditor.
House Bill 1210 directed the counties to have a municipal unit strategic task force. And the council will choose one representative from to represent the county council. And if the fiscal officer from each city and town will be in the committee. And then they are to negotiate and establish through unanimous support a local income tax distribution agreement as it pertains to the county's maximum local income tax rates. So we would have to agree on a municipal rate. It's only the two items that it is. And the AIC has recommended the auditors.
You're a representative.
You guys get to nominate someone.
So we can nominate a council member or the auditor to be the official, MUST mini representative. That said, it is a public open meeting, so can be attended by multiple council members. I myself plan to attend, I was requested to attend, so I plan to.
I would make a motion to nominate the auditor.
Been moved by Dave, is there a second?
Second, this.
No. Second by, Mr. Dillon. All those in favor,
We'll see if there's any other nominations.
are there any other current nominations? Family, see any? I'll go ahead and call for the vote. All those in favor of the auditor being appointed as a representative for the MUST committee, please raise your right hand. Opposed? Motion passes 7-0. Council, we have the review of the Wabash County-wide circuit breaker report. We do this annually. Does the auditor have anything she'd like to add at this point?
As you look across the top of the circuit breaker report, it will show all the new credits. That is, like, after we hit our max levy, these credits are unfunded mandates, so that will take up our income. If you're wondering how, even though we have a 6% growth, we're still having them. We have to cut a lot. The top line right here will be the line to look at.
What about the countywide total or the individual municipalities, like here's a
Yeah, they have theirs. And I put in 25, so you can see the difference between the 2 years.
Questions for the auditor about this?
Sometimes in the past where we've changed percentages. Is that for this? There's just something else.
This is something else.
Or something?
Okay. It's been a while since we did it.
I have a request. Since we have so many departments heads here, could we read off these numbers so everybody's aware of what we're looking at here in the circuit breaker report?
Each individually, or do you want?
Sorry, just the county.
specific.
For the county specifically,
Let's stick with just the county specifically, ours, yes, please.
Over 65 circuit breaker, 71,166.81. Supplemental homestead credits, 197,008. Over 65 credits, 16,000. Blind disabled credits, $6,119. Circuit breaker 1, 2, and 3%, 180,617. For a total circuit breaker of $471,010.81.
Thank you.
Other questions? Please let the record reflect the council's been presented with circuit breaker credits and has reviewed them at our meeting. Next, we have a transfer request.
Motion to approve.
Second. There's been a motion and a second to approve a transfer request within weights and measure by decreasing postage $50 and increasing miscellaneous supplies $50. All those in favor, please raise your right hand. Opposed? Motion passes 7-0. Good. I believe that concludes my list of new business. Unless I missed something. We will now move to old business regarding a stipend request for the maintenance supervisor for duties performed outside normal job responsibilities. This is from a previous meeting or two, actually.
We have to make a motion to move it from the table, or is it just click it? Yeah, it was tabled at the last
It
meeting.
was tabled at the last meeting. So here, what was yours?
Are we still, do we have to take it off the table? A motion, or is it just part of
It's on the
agenda?
agenda.
Good. Okay. Or just checking for procedural.
I think it was tabled to the next meeting, so since it's on the agenda, no, you do not have to.
Okay.
Thank you for the clarification.
Okay, so. After a robust conversation and careful consideration during executive session, I move to deny the request.
I second it.
It's been moved by Dave, seconded to Rhett by Rhett. I'll now go ahead and pause before I call for a vote. Any further comments or discussion?
Can you give us some information as to why that was denied?
I don't think we can, it's a personnel issue. Ask him.
I do not know for sure, for clarity, if all matters discussed at an executive session.
We're supposed to keep those confidential, but that doesn't mean that some sort of explanation can't be given, but without me knowing what the reasoning is, I don't know how much I can say, you can say. But if that's Dave's motion, and that's what he's given.
Okay.
I guess I would say this to you, Jeff, when the meeting's over, if you want to have a discussion, we can have a discussion, but I really don't want to. Since it's a personnel issue, I don't want to go into it in a public meeting.
So I guess my question is, why do we have the PAC committee? If you guys making it in the PAC committee and bring it here and then turn it down, there's no reason for that PAC committee. Zero.
The original one reason for the PAC committee is for additional investigation, so that if a department head brings a matter, instead of just coming to council, presenting it, council asking a bunch of questions, sending the department head back and forth, there's a little bit of exploration by the PAC committee to do some data mining on it. Now, it's not perfect and it's not binding. I will give you that.
But it doesn't feel like it's any different because this is the second time it's on the agenda with a different outcome from a PAC committee that made it this way and then brought it different and then did it again. So we're doing the same thing in a sense. Might as well just get rid of that and just have them come here. It's been 2 months now.
I still feel there's value to the PAC committee, especially when there's some discussions without necessarily the employee present.
Yeah.
At a PAC, I mean, they're not typically supposed to be present at a discussion in PAC after.
It's usually the department.
It's normally the department head at the PAC meeting.
And I guess if you know, we looked at, I'll just tell you what we looked at. We looked at the wage study. We looked at the, request. We looked at the other aspects of the job.
I have something to say.
Yes.
You
May
originally,
you state your name for the meeting minutes, please? Okay, proceed, thank you.
originally the PAC committee did pass it. Or, yeah, recommended it, and then Mr. Turflinger tabled it. And he said it was because of the double dipping from compensation for the comp time, so I guess I'm not sure why we're denying it, because that's found to not be true, that there's no double dipping.
And I will give the explanation that, I don't believe in the majority of the executive session time was spent on that. It was, other discussions about the compensation for that position. Not the comp time piece of it.
And who brought up those discussions, and you can't say.
I don't know if I would say, even if I could say.
I guess if I was an employee and I had been doing 2 jobs and I was denied compensation to like that, I'd be pretty disappointed, I think. For sure.
Well, there's been discussion on this. Dave's mentioned he was willing to have other conversations. As council president, I will definitely be having other conversations with commissioners regarding this issue potentially, if there's needs to be off some clarification provided. That said, there's been a motion and a second before us. All those in favor of the motion to deny the request, please raise your right hand. Those opposed? Motion for denial passes 6-1. Believe that concludes our,
I got something under old business.
okay,
Comp time. The council said last year we were paying it all out at the end of the year. And, you know, it's not a savings plan, it's a comp time plan, so people can have extra days off work, but there's a potential for this thing to snowball. And I know we said last year we were gonna pay it off to 0, so if we're gonna do that this year, I think we need to make the decision and let all the department heads and the employees know that they got till December 1 to use their comp time, or get it scheduled between December 1st and the last pay, and then it's gonna get paid out.
as a point of order, I believe my memory is we authorized to pay down to 80 hours.
We paid everybody to 0 last year, right?
Either one of them are employees.
Last year we did,
Paying that to 0,
yes.
Yes.
because I'm not against that policy, but before I were to
There
myself,
was 1 or 2 missed.
correct, we did miss it. It's not required by law to pay down. It's not required to just, the 80 cap is not required by law. I don't mind paying it down again. At this point in the meeting, the only question I have is when, in regards to certain jail staff, emergency personnel, how those department heads can handle that situation if we've budgeted enough overtime for those emergency services.
And
It would be,
that's another reason I brought it up, because we're preparing the budget. If we're gonna do this every year, we need to put that, make sure there is enough overtime money in there to pay it out at the end of the year, because we have the potential of a big snowball running over us in 5 or 10 years, so. That's why I brought it up tonight for a couple reasons.
Well,
I
for,
think the general consensus was that you could carry 80 hours of comp time and that was it. And anything above that would be paid out automatically. I
Right,
know there's no policy on that,
right,
so that's what I think you're bringing it up for, is that we would like to see a policy established that says that by the first pay in December, if you've not used down to 80, it will be paid out, leaving 80 to carry. And of course, there has to be some exception for jail. I mean, anything that was an emergency. Hey, I couldn't do it. Oh, I happened to work 20 extra hours the third week of December. Okay, that we're gonna have to.
yeah, we have to address it, but
Yeah.
are you saying that
But
they're
flexible.
gonna carry 80 through the year, and then at the end of the year, they get paid out down to 0?
No, they can.
Okay, so if they carry 80 hours, just for point of clarification. That they're earning today at $26 an hour, and they carry that 80 hours for 10 years. They're picking up every raise every year on that, and we could end up paying that out.
The bank is only 80 ever, Dave. Once it's
I
full,
understand, but
that's it.
they could carry 80 hours every
Yes,
year.
yeah, all right, yeah, inflation's gonna get us, but that, I mean.
Yeah, and that's
On 80 hours at most,
exactly.
so I'm okay with that.
So most industry standards on this is 40 hours. Just saying.
In Manchester, 40 hours.
Is this a council
The federal
ordinance
states.
or commissioner ordinance?
So HR policy, it's those guys.
We can still discuss it, but
Yeah, that's,
make our advisory recommendation.
Thank you.
that's what we would like to see. That's why I'm saying that part.
Okay, so in consulting with the county attorney, our position, where we need to land is make an advisory position to advise the commissioners. We as council controlling the funds, we need to have the funds allocated for an advisory position or a position that the commissioners do take. I think at this point in the year, we do have maybe a meeting or two left where we can formulate that and work with commissioners in the meantime to get a cohesive plan, because basically what I don't want to happen, Dave, is we say this, commissioners say that, and it becomes a big fight. But-
Absolutely, but we're doing the budget right now, and I don't wanna have to come back later and have to come up with all this money to pay it out. If that's what they decide we wanna do. So we probably need to put it in there, right?
We typically have paid it out of rainy day. Is that
Okay.
correct? Or
Yeah.
the cash balance?
The ones we paid out had funds in their fund because they didn't have people in those positions and we moved it to the overtime line and paid them.
The auditor's memory is correct, that departments, larger departments that weren't fully staffed during parts of the year had extra payroll where we could fund this, and that's where we first chose to go.
Yeah.
However, we do have a few other options if that
Yes.
does not work for 2026. So I will take it upon myself with communication with commissioners to bring that before either the September meeting or October.
Good enough.
Anything else in old business before we adjourn for the regular council meeting?
That was a very council meeting.
We adjourned this
Okay.
sorry, board, from. Is there a motion regarding adjournment?
Sure.
Thank you.
Where are we starting, Kyle?
At the beginning.
Again?
Yes, because
Where's the pages though? Where's my memory? Cheryl said it's emailed Saturday.
Some of that.
You're sitting here like shaking.
Reasons for.
This is fun.
I don't know. You're not doing for jobs.
Point two, that must be. So.
It's not, it's about.
You're already there.
Yeah. So.
Yeah.
They're not even.
I wasn't listening, I'm sorry.
Sure.
Recess of the 2027 budget hearings. Council, as we begin this evening, we will work through the book from front to back again, reviewing accounts. We've spent some time going through these, but there are department heads and others in the room that would like to see the numbers and see where we're currently at. And for those in the audience, I would say as we approach your budget, as we're in your budget, if you have questions, please say, wave me down, because I don't mind answering a question, point, or going through things in more detail as well.
Sorry, he stopped flashing and I'm freezing.
So there's a room temperature issue. Some minor changes, council, that have occurred since, we gave the directive to the auditor and their staff, her staff, to look at account balances and fund or account line items. And if they have not been expended in 24, 25, and 26, meaning they have a zero amount from them, then we have removed them.
No, I put an asterisk,
Okay, she's put an asterisk for us to
so
discuss.
you guys can decide.
I have said in previous budget hearings, I do not want to create a culture of use it or lose it. But we felt if over the course of 3 years, you had not spent $1 out of an account, we could probably remove it for the time being, and it'd be a safe historical context that we could remove it, or at least review it again this evening. So I will rely on the auditor and her staff this evening to make sure I cover each one of those, because I'll probably get breezing through.
Can I ask a question?
Yes.
Does that include certain accounts? I'm gonna mention like conversion or?
No, I apologize. It would be
I only did the general fund.
the general fund.
Okay.
Sorry, Jeff. I should have.
That's what we
Good
needed.
question.
That's-
I just wanted to clarify.
Yeah,
Yeah.
just general funding.
I only,
Line items in that account.
in the general fund only, because that's where,
For example, I'll pick on the clerk this evening in 21, well, she actually has one. We'll go to postage.
Yeah.
That account has an asterisk beside it in column O. And so,
wasn't already, didn't know.
and so we have removed, this is what started the actual discussion. So that's why it's removed currently.
How's the clerk gonna have postage?
Commissioners.
Yeah,
Oh,
We have-
all right.
We have a postage machine.
She knows.
yeah, no, we have a postage machine that you guys have in the commission.
So we,
Yeah.
so since she has not needed to use it because
It's in her
they're
budget.
within her budget, the commissioners have a large budget item for postage. We removed it here, for example.
Yeah.
Is there anything else I should cover with me before we start? Yeah. As a reminder for council, we're currently at about $1 million or so. There's a calculation to come in the future, but about $1 million over levy.
But that TV is really slow. That's, I'm looking at that TV, it's.
And you will
It's
see,
delayed.
yeah, you know, it, in 2 minutes, you'll catch up over there, so. It's on. Yeah. We call it Nick Cop.
Can we make fonts on that one bigger?
Yes.
Brett can't see it.
Yeah, I brought my glasses. Yes, I can today.
Sorry. No, I love this game. Just makes it like, I have first days like upper room gamer, like, well, yeah.
That's right.
Emily, that's too big. No, I'm joking.
Okay, so before us, we have the clerk of circuit court, location 01. And you're welcome to take pictures of it too, but when it gets finalized, we'll make sure there's a digital copy sent out to department heads. Commissioners, since you're behind me, just if you have a question, holler, please. If nothing there, we'll move on. Location 18.
I didn't mark anything in there because she doesn't have that budget every year.
So since this one is not cyclically challenged, we'll. So I believe no current council adjustments. Moving forward,
I got a question. Polling places rent. A number of years ago, they changed where you vote and all that. Is this just a carryover or are we still paying that much?
Polling places rent, I think that's just put in there in case we need to move a polling location to another location. They typically can't charge us rent.
What did we use last year? Or what?
I mean, I think Lori's put that into play because of maybe moving the early voting from the clerk's office. I think that's where that.
I believe that was the discussion, was to have not just an election day coverage, but it was to get the traffic out of the courthouse. But since that hasn't come to pass yet, do you have plans to do that?
I mean, it is inconvenient having all that traffic sometimes, but we don't have the manpower to have it at another location because we have to be there and.
You have to
pay poll
workers, right? Did you use the new conference room with the health department?
they have one.
I don't know, you have to ask her.
Still,
I would see.
still offsite.
Manpower,
It's still, you still have to have. someone visit.
Right, it's like if they have to.
the old gym.
There's now a conference, actually,
no.
there's a couple of rooms that could be used.
I mean,
You'd
we
have to
still
have-
have to go back and forth, but I
Well,
mean, it's more convenient in the clerk's office. It is a pain to have that many people, especially a presidential election.
Mm-hmm.
It's a lot, plus the parking, especially if there's a jury trial and. I mean,
That's what I'm saying, over here might alleviate some of that.
Park section there.
I mean, if there, we would have to definitely have Wi-Fi.
I'm okay with the
I
reduction.
said they got it.
I would be comfortable with the reduction in this account, and if you do just find a location, find something that would work, coming to ask for us, and I would definitely approve it, so
Yeah. So you just take it out.
that would be fine. Other items with location 18. Okay, we will move forward. Location 19. Next would be 1119. Or 11. The outside of county general, but still needs reviewed. And per your email, we have not made any changes in this account for this year.
What were we looking to do with that?
With some of the wages from the record retention that they're doing, the scanning and the.
Okay.
Yeah, I have to put your part of a salary or something.
So her computer IT line is 0, we could move that from 18 on 3501. She's got 2,000 back in 18, 3501.
The question being, your county general fund, you have some computer equipment,
Computer IT help 3501.
computer IT help. Is there parts of that that would, in your opinion, qualify for the perpetuation fund?
I don't know if IT help would actually fall under the.
Well, I just saw, okay, because it still would have to fall under the, yeah.
Yeah.
Okay.
I would say probably not, based on it being on election software and or voting machines versus record perpetuation.
Equipment repairs, $4,000. Under 1119. How much did we spend last year?
Doesn't matter, that's a fund.
Huh?
I mean,
That-
we,
That is her fund that
Okay.
only she can use and
Okay.
It's a very restricted fund.
And if there's nothing else here, we'll move to the small print, 8889 fund. The 4D incentive. No changes here. This is a partially reimbursed fund. Okay. Then we'll move to soil and water next. Is that correct? Doesn't seem correct. Corn, I believe.
it's the corner.
Okay.
They traded spots.
So there is an asterisk by training for $2,000.
Do we? You might wanna leave a little bit in because I know his main deputy is running for office and has won the primary, so he's gonna have to train one of his new deputies. So if we're gonna cut it, we don't wanna cut it all, cause he's gonna have to. Somebody's gonna have to get certified to be a deputy.
So is there such a thing?
They do have training. They haven't used it in 3 years, but I mean, there's always someone that might want to do training. I mean,
Additional privilege at any time. Right.
Now we could do that too.
So is the majority opinion here to remove it completely or?
Yes.
Yeah, maybe if you need to, what you're doing,
With that, cash.
Does the auditor know if he is transferred from this line item often?
Would we know that, Shelley?
yes, we would.
Okay. Cause I just know that
He,
autopsies
he
went.
does move his stuff around and not come back. He tries to move it around so he doesn't have to come back. I'm saying that in a good way.
Yeah.
He is increasing line items on autopsies and.
Yeah.
And x-rays and all those things.
Okay.
Based on his usage, so I
He,
think
he
that's.
has
that's
moved it
fair.
up to autopsy.
That's what I thought, that's what I thought he did, so if he
Yeah, but again-
increased that, then cut it.
I mean, I think we have to be consistent.
Yes, we should.
Unless there's a very, Large-
Articulable reason.
yes, outlier, we'll go ahead and rely on trying to cut all the asterisk columns. Anything else with the coroner? Now we'll move to the next account.
With the prosecutor.
That is the prosecutor 08.
Any asterisks?
We'll move to the next account location. That'd be his 4D09.
Got happy.
Asterisks here.
Yeah.
The articulable reason here being the 4D's
It is reimbursed.
reimbursed.
If he would use it, it would be reimbursed at 40%. But those are the 2 lines. Yeah.
Yeah.
Telephone.
From 24, 25, and 26 has.
Yeah, we should allocate some of our telephone costs to that line no matter what. We're gonna get 40% of that.
I can reach out to him and ask him if he can, 'cause he has it in 8, if he can pay any of that out of 9.
Whatever little bit helps.
So now are we saying since this is the 4D, we're gonna leave it in here for time being?
Well, depositions, I don't know why he had those. I mean, I could say, but he hasn't had, so.
Why don't we just, rather than if he can't move it into 9, we'll just have to fix it.
Yeah.
I'm okay with that.
So reductions of $400
Cutting all the asterisks, I mean,
and $2,300 reduction in phone. Next, we have pre-trial diversion. 2501. I don't have any changes here.
It's fun.
Moving to the VSO office,
are we leaving the $10,000 increase in there for office furniture?
In 2501,
office furniture.
that's an outside of,
It's his fund.
Okay,
It was just maybe
okay.
VSO. We made some reductions here. Commissioners, as you, we used. There was a greater than 3% increase in the first line item.
and the increase on the assistant, 412.
Yeah.
24.
442.
Anything else here?
You did raise the assistant to meet the same deputy salary as the other.
Based on the wage study and the salary matrix,
Yes,
the per hour rate actually should have been higher for that.
you should have matched
Match
the
it,
part-time.
part-time within the county.
Yeah.
Right.
Okay. Next, I have the surveyor's budgets.
Right. Has to wait for it to stop.
So towards the top, I believe there's currently no changes. Except the bottom. There's much discussion about the camera. To summarize, we felt with the commissioners being on the drainage board and with the 2026 funds available, we weren't willing to rule out the camera. We just thought you could discuss with them and the auditor, and we have some areas we think we could currently budget it from, as well as we still thought maybe there's some cost savings that could be captured. But again, commissioners of the drainage board, we thought there were funds currently available.
Somebody Googled and there's one real close to the one that you asked for, that's half the price,
Okay.
so,
The training.
No,
no, that was just the camera.
but we're thinking that, again, as Kyle said, that maybe it could be done this year.
Yeah,
Okay.
that would help. We got several already to go, we could use them.
Next, we have drainage board. Love the actors.
Oh, geez.
That's gonna hurt.
No, tell us, I mean, again, if you can tell us why you haven't spent anything in 3 years, but you still need it. I mean, we're willing to listen, that's the thing.
Partially with our engineers, what we use it for, when they come and attend meetings and things like that, or go out on the ditches with us. And then John Stevens, if he's doing us like a benchmark or something like that for us, that's what that's for too. Cause we have the other protection corners, but this is benchmarks for our elevations for our drains and things.
I believe the 10,000 was discussed based upon current year. Go ahead, Matt, you.
Yeah, I think we looked at what was spent in the last few years and we averaged less than 5,000.
I would, if you could, we've got several reconstruction drains that are lining up.
Okay, so that makes sense to us.
So yeah, at least if you could put 5,000 back in. I would appreciate it.
Yeah, I know the dream, yeah, I know what you're saying, so.
That would be fine. And then Matt's other, what he was describing were the
The asterisks.
the five lower asterisks where we haven't used those to just. Yeah, we're not against you having those lines, but
So what, I can't see what we're.
Oh, feel free to stand up.
Can we turn that thing because
Probably mileage is basically the.
Which way you want to turn it?
They used it, but
Like-
it's always been there. That helps. Oh, yeah, it helps. Partially because if they have to travel to another county for a joint board or something like that, that's when that was used. We've not had a joint board for a couple of years, but could come tomorrow. I don't know.
Well, we're not gonna not pay it, so it's just budgetarily, if,
Printing, that's the envelopes. We're probably gonna be getting some more envelopes before too long. Legal ads, I've been taking those. We usually, what, by law, you take it out of our fund and then fund turns around and gets reimbursed by the ditch. From talking to the auditor in the years past, we just been taking the legal ads straight out of the ditch fund. So that kind of bypassed that. We just kept it there just in case. State Board of Accounts says, you're not really supposed to do that. So we would have something there.
so you're, wait, hang on, back up to that. So you're saying how you've done it previously is gonna change and it is gonna come out of here?
If they tell me it has to, but so far nobody said anything.
Oh, okay.
Yeah, and we've been doing it this
If it-
way
if
for
it-
probably
If it changes,
6
still,
or 7 years.
Okay.
Yeah.
come ask you for some.
All right, that's fine.
Simpler to do it this way because it's less work for the auditor too.
Yeah.
The 2,000 was a watershed contract with Schneider. Basically, I'm still gonna need some help getting all the watersheds put together because I want to do that before I retire.
Is that a newer thing
No,
or?
no, when things are changing with my pros, so it's basically I'm gonna need a little bit different training than what I've been doing. But before, when I would use them, have them come up for training for watersheds or do anything with the watersheds, drain calc, things like that. Then we had enough flex time left that they took it out, but the flex time instead of using that. I
Are
don't
you down
know
with
if
flex
things
time?
coming up, pardon?
Are you down on flex time?
That's what I gotta figure out because I don't have a thing with running total, and I don't know what somebody's gonna need, just like the county highway called me and said, hey, we need help from Schneider, give them some stuff put together. You know, plain commission's wanting to do some things, they need help, so I never know who's gonna need flex time.
Again, I would say,
But it
if,
wasn't
if
part of the
you,
original.
if you need money for that purpose, just come back to us.
Okay. Let me here's
And we did change the professional services there to increase that size.
equipment repairs, yeah, I have dipped into that too, the year before for our, attorney.
Oh, wasn't it?
When we were taken to court. Equipment repairs. Are we gonna have breakdowns? Right now, we're getting ready to send our laser down to Siler to get it recalibrated. So we will use some of that for that.
Put that back in, well, yeah, I mean, it's only $300, how much is that gonna be? Probably
I
more
don't
than
know
that
yet,
$300
but
bucks.
at the end of the year, in case we have to use them.
Yeah, I'd say, yeah, so she knows she's doing something with that line this year, well,
We only do it like every so often, have it recalibrated, so.
Every year, or every other.
No.
Except this year, next year.
well, if she's doing it this year, she has it, so that's right.
And we have been using it a lot more since Brady has come into the office.
It's 300.
If they buy the camera too, it's gonna take. Yeah, put it back in, or you did, right?
It just took a minute to get over there.
Oh, yeah, I was.
Well, actually, it took 2 minutes.
anything else here?
I'll try to do supplies, I can, if I run out, but I can come back.
We'll move on, GIS.
That one I do have some changes for you because I've got some more firm prices that came to me right after my budget.
If you wanna start with those, that'd be fine.
The web hosting. 30151.
Yeah.
Support, that can go down to 1,800. The $2,000 one.
It's matter support claim. 30151.
It'll be up there in a few minutes.
Okay. Yeah. Yeah. Sorry. Web hosting. 16,000. And they're 14,500.
Minus 1,500.
Yeah. 9,700. Yeah, that one has to be 38,800.
So it needs to change from 900,000.
So it'd only be a $900
Yeah,
reduction.
Instead of 900, or 1,000, it's 900.
Oh, here, yeah, got it.
Correct.
Travel mileage, a lot of times, because we are doing it through the surveyor's office, we use our travel mileage with the county truck. So we have been using a lot more mileage because we've been out checking a lot more things than we used to for a while. So I guess if that gets depleted, I will have to come back.
What about training?
Pardon?
What about training? You have $4,500 in there. Did we use that last year?
That is something that's not, it's not just training, it's training and project assistance. So we have an additional in there because I know there's some new things coming, like we have ring count that's gonna be moving to Beacon. Land use for the assessor is going to be moving to Beacon. So those are additional trainings. And then we also sometimes with our aerial photography, we need extra for that because we have to bring that in from the state and it all has to be checked and viewed and so that's an additional cost.
Just a comment going forward, because you got a couple new guys here. If the details on what those are for was a little more information, it would be helpful.
Yeah, cause I can have it on mine. Beacon web hosting. WFS hosting for the Indiana map. GIS contractual support. That was the 39, 38, and the others additional training and project assistance for the 4,500.
Which we left in there.
Biggest problem with some of this is we've got several departments that may come to them and say, I need this, I need training, or I need this done, so. Like Sharon's maps, yeah.
There's nothing additional currently here. Go to the auditor plat book.
If I lose something, you might ask me that.
Definitely come with it.
Well, with all the new stuff coming, what's gonna be needed?
What we're dealing with Sherry's, I mean, the money's, it's getting really tight. Because it has to be one, and we're trying a little bit further than what we've been able to do in the last few years. Kind of hurts, but I think, I don't know for sure, but we're trying to keep the raises
Yes.
and not miss those. Because we want to invest in our people. And
I just know with the GIS, a lot of that is the function for their offices. And they come to me and they need this stuff that I'm responsible to making sure that it's there to give them the training that they need to do.
We will,
Do they have money in their budget for training?
Not for this kind of stuff, no. That I'm aware
So we have the 1181 auditor plat book. Outside of county general. Sherry, there was the reduction here of $500. On the top line item.
Just now, I wish you guys would go talk to Rachel and just see actually what she does do. There's not anybody on the street who's come in and know our pro and GIS. And reading deeds.
Next one I have is the perpetuation fund 1202. No changes here. You got one. We'll move to the commissioner budgets next. First being 029. Guess I'll take the lead on here. There's much lively debate, commissioners, in all these budgets. And when it comes to personnel, you can see we've adjusted the wages down for these two positions. We have made some additions to PERF, FICA, health insurance, and workman's comp in order to satisfy what we believe will be our liabilities next year. So those are additions, as you can see, of 300,000.
There's only $8,000 in soldier burial. Have we ever used it?
yeah, I looked it up.
We do use it all the time.
Okay.
We don't
Sure.
use 8,000.
No, I'm just saying, you know, I don't think you could bury one person for $8,000, so I just wanted to know what we were spending.
No, it's $100 a person.
It's just a little subsidy, it's not.
Oh,
For
okay,
like,
Yeah.
if they want
Yeah, no.
okay, I get it,
for a veteran, they can get $100 back on
on a burial.
not the not the actual person, like the relative. Can get assistance for their stone
Right,
to get that on there.
thank you for the clarification, I just. Look at the next one, you can't bury stuff for $8,000.
There is the change of venue for
There's another one, yeah.
and animal testing.
Huh?
I don't know.
Forgot about
Fair, I won't go there.
That's probably a legacy one, I mean,
So
But we obviously haven't spent it, cut it out,
Yeah, sorry.
change of venue.
is there anybody, do you know, Jeff?
Is it like,
Animal testing that we,
is it like rabies?
oh, that's what it was.
It's the only
Health
thing I can-
department does that now, so,
It's the only thing I can think of.
so I'm like. Just didn't.
I don't know, he's a beast.
it's a beast.
Yeah, maybe.
Council also made a reduction in the exam of records and wards here currently. Get those closer to what we expect. Before I move forward, do the commissioners have any questions? Or concerns?
Not yet.
Okay. Courthouse complex? few of these line items, I believe the security officer supplies is actually in the judge's budget as well, so
He increased his,
we removed it here. Don't necessarily want to dive too deep right now into it, but since the building repairs were put in multiple places, they've currently been removed.
we did leave some here, Kyle. We left some in building repairs, but the rest of those. We kind of tweaked.
So the 50,000 there is more for miscellaneous odds and ends that you guys encountered, not so much the capital projects.
Yeah.
That riverboat references, there's more in riverboat for the building repairs.
Okay. So there were also reductions made in lawn care. We had been told some of those improvements had been going on for landscaping currently. And $200 reduction in generator maintenance, and the preventative maintenance reduced by 10,000. Questions with this courthouse complex?
Do that reference. For the ambulance.
Maybe later.
Okay.
Yeah, sorry, forgot about it already, to be honest.
We can take them out.
Okay. Next, we have edit fund 1112.
I didn't really zero it, yeah.
There was again lively discussion about this account. Anybody else want to speak to it?
Blow it up. Expand it, make it bigger so I can see it.
This is where we kind of have housed the funds to do a lot of the work that is on your
No.
punch
That's
list. Yeah,
CCD.
Oh, is it CCD?
Well,
Yeah. No, there's still some down there. Oh, maybe that's on the same screen. Oh, okay, all right.
So that-
It's currently here, I believe.
We can't see the fours, which is what
Yeah, that's what I'm talking about. It's right down there.
the courthouse
Well,
renovation
Wait,
are
yeah.
in CCD.
okay. All right.
So there, well, it's currently a subtraction here. Yes, we've leaned towards budgeting the repairs and the capital projects campaign out of the CCD fund.
Yeah.
So I have, as the liaison to the animal shelter, I'll just do my due diligence and just speak my piece, if that's
Oh,
okay.
that's in this budget too.
Yes.
Yeah. So the animal control, I do have their profit and loss statement for the first half of the year here, if anyone wants to see it, but for the first half of the year, they're $35,168.68 in the hole. So their request isn't huge. And I mean, even if they get $60,000, it probably wouldn't put them in the black or anything, but. I know from what they are doing now versus what they were doing, they are vastly improved. And like I said, the animal control officer salary. Would probably be something I think we ought to at least look at for. Going forward, maybe maybe not this year because I haven't really talked to them about it, but. Something I think we ought to try to look at least match. Since it's a county ordinance requirement to have one.
And they've come a long way. One, the fact that you're on their board now, they're more transparent with us.
Mhm.
We're seeing more results.
Doing more for county services, they're helping the sheriff's department, I believe. I just put it out there, just because I'm the liaison and. You know, I am doing that
Well,
service, yes.
As we work through several of these.
And I agree that they're doing better. We're doubling what we gave them last year. I mean, that. If next year,
Right.
I mean, obviously we got some.
Look at an increase for next year as long as things continue to improve. It only takes one giant hiccup and we're right back where we were before. We've already spent the money. We reimbursed them for the audit that we asked for and all that. So I'm fine with 50,000 for this year. The sheriff's department says they're doing a better job. So let's just, with everything else that we're looking at, you know, I'm kind of looking at that as an asterisk. It's like, okay, we increased it to here, but I'm not ready to go all the way to there yet.
Yeah, that's
right.
fine.
Yeah.
As liaison, I just feel like I should at least say something.
Cause you did, Tyler, I don't mean to put you on the spot, but you did say they're doing a better job now, right?
Oh, for sure.
Okay.
As we look at these other lines, I mean, I hate to make council go through and individually vote on each item, so if we can get a majority consensus. That's apparent.
4-H funding. Does anybody know why that got cut? I know Nick asked the question, but I never did hear an answer. I mean, where did the request come from, Shelley?
The commissioners did it.
Commissioners did the budget.
What?
I don't remember that.
Yeah, it's on there.
It's just on there. I think you said we always did 5,000.
We've
I've
always-
been here long enough to know the difference,
We've
so
always done 5,000 for quite some time, but I
that's
got,
back there,
5,000 is what it's been in the past.
So we're good with the 5,000? Is that what you're leaving us with?
They bumped it up.
It was discussed the previous year, we did 7,500. So I believe. There was opinions on council to leave that put at 7,500.
Jeff, do you know,
I apologize, my memory was that it's been, I don't know if I was at.
I think it was just a 1 year, I think
Okay.
you're only missing out on 1
Gotcha.
year, but yeah.
Jeff, do you know, are we using those funds to pay rent to the fair board?
That would be a question for the 4-H council,
Yeah, it's
because
like
it doesn't come to my office.
Ribbons, it's trophies, it's 4-H council.
This one is?
Yeah,
Ribbons
it goes to, so it could potentially go to rent, whatever their expenses are.
So we're paying,
Things have gone up, so.
we're paying a lease to lease our own ground.
You could look at it like that, yes.
Okay, just clarification, sorry.
Where is the?
Yes, sir. Could you say your name just to help me out?
Justin Gillespie. I just wanted to make sure you knew I was here to talk on one of the line items.
Okay, go ahead and speak to it and point it out and let us know, please.
All right, I'm talking about the line item of the Grove Canal Foundation.
Okay.
So my background, Justin Gillespie, I own the 950 Speakeasy and actually 3 properties, or 2 other properties adjoined to that. So I'm an investor in the Grove. I've also sat on the board of the Grove Canal Foundation since its founding, how long ago? 2016. And I just like to speak to some of the projects they've been involved with or directly involved with over the years to kind of give maybe a better idea of where taxpayer donations or funding has helped with that organization. So for example, me being a business owner, I mean, one of the reasons I even had the courage to invest in LaGrow like I did, not just because I lived there, but because I knew there was organizations and other investors coming to town because of the things that LaGrow Canal Foundation is doing. And I can attest to just my property tax alone, when I started with the Speakeasy, it was probably about 800 annually, and now it's 2,400 annually. So I know the assessed values are going up in LaGrow because of a result of the investors and LaGrow Canal Foundation doing what it's doing. If I did just a rough head count of some of the projects either we're directly involved with or indirectly involved with, and again, some of the indirect ones I know because these are contractors I tried to get involved in Grove 10 years ago and they wanted nothing to do with it. Until things started happening and now they've invested in multiple properties, building houses where houses were vacant or ready to be torn down. And I can count up to probably 25 projects that again, the LCF has been involved with or indirectly involved with or helped facilitate. Some of these properties we didn't know, but we helped facilitate investor getting with the property owner to get that property and now there's houses sitting there. So even if you took my average increase in assessed values over time, let's say you averaged $1,000 property of increased value over time times 25, that's $25,000 a year. I've been a part of some capital investment projects, and if you said in 2 years I was gonna get my money back, so I believe over time, this board has probably given us roughly what, $50,000 over the life of the LCF. I'd say that's a pretty good return on your money. So we greatly appreciate all the funding you would give to us, and we just want to make the statement that, you know, it's not going, or I guess it's being put to good use and the county's actually getting a return back on their taxpayer dollars. So if anybody has any questions for me about regarding the LCF or some of the other investments going on in Grove because of the LCF, glad to answer some.
We actually don't get any of that money because you guys tip the whole town. Any of that improvement stays right.
No, that was not the LCF, that was the town.
I know, but that means we don't get the money.
It's all the LCF.
Well, how much does the town give?
But I can also count. What?
How much does the town give you guys?
About 20-some jobs have been created because of that. We get zero funding from the town. $0. And none of our board members get paid. I've been after this how many years? Well, we said, what, 7 years? Got paid $0. All our money, that everything we get raised gets put into these projects to bring people back to the community. Right now, I got a young lady want to put a business in another part of my properties there in the Grove, and she's moving back to town from Westfield and wanting to start a new business. So that's sales tax, you know. I
So the
don't have all
redevelopment,
that behind the scenes.
the LaGrow Redevelopment Commission should have plenty of money because of all these projects. And if you guys are partnering, you should try to partner with them. I mean, we're still giving you what we gave you last year. Oh, I thought we were, all right, we're not.
I would
But-
move, just to be consistent with our cuts, I would move to give them 5.
Well, hang on, Dave. There is another source for some of this stuff, Justin.
That's what we get.
Community Foundation is planning on supporting a lot of these nonprofits that we have to cut. And everybody has to understand, Indianapolis did this to us. If you were here earlier, you heard what the property tax cap circuit breakers are, so there's nobody exempt, you know, and we supported you last year. We supported you the year before. Somerset come, they had an issue, they didn't have any money, we supported them, so this has to be on a turn basis, and with what we're facing, we're still $1 million away from getting it, so, you know, I guess my comment to you is go talk to the Community Foundation if you really
I'm not
need it.
saying
Yeah,
you all have to do what you have to do as far as what the state's done to you. I'm just letting you know.
we realize.
We feel like we've done our due diligence on trying to benefit.
No,
the
you are,
county,
and I
let
think
the-
it's growing, it's doing better.
Right.
But that money staying in the grow, you need to wrangle your redevelopment commission people and say, hey. We are doing good things. We need some of that redevelopment money that you tip the whole town. So any of these improvements we're doing, that money doesn't go to the county. It goes to the redevelopment commission and grow.
But when did that start?
They'll get their first distribution with this budget.
Okay.
So, and as you see, the Somerset Town Board's not getting nothing either. I mean, we
Yeah. like I said,
we appreciate what you're doing and you're helping the county grow and all that, but at the end of the day. We got serious cuts to make here, and like we said, there's no golden goose,
You
you know.
gotta do what you gotta do, but I do, this buddy come here and try to fight for
Yeah.
me. Fight.
No, we.
You know what? I sincerely thank you for coming and presenting your case, but, you know, we still gotta find $1 million,
I
so.
understand, well,
Continue to fight and do our work and, we helped you, so now this year you guys are gonna help us and there's still another, and you can also apply to Region 3A too.
Dave,
USDA's got all kinds of grants.
Dave, Nick brought up a point he would like to express.
We'll just, I would move, we give 2,500, that's half of last year to be consistent with some other cuts. So somebody needs to back me up on that, I guess.
Yeah. There's been support by Rhett. Or at least.
Just be okay with that.
Okay.
Thank you for speaking, Justin.
Thank you very much.
Thanks for coming.
But there are some other avenues for you guys,
Sure.
and just, you gotta find them. I mean, and we can help you find those if that it will work for you.
And thank you for bringing those to our attention.
Somebody just mentioned the region,
3A.
but isn't that just the town that applied to that, not the foundation?
There's USDA grants, you would have to, what's her name, Sandra?
Sandra Thomas.
What?
Sandra Thomas.
Sandra Tomez would be the person to talk to, but there's 39 pages of grants available, so.
And you guys may be eligible, because I know that Manchester Alive got one of those grants.
Yep,
So yeah, you guys are eligible for some of that stuff.
and she's in what, Columbia City?
Kendallville, somewhere up in there.
No, the other lady, the lady that does the commercial stuff from Kendallville, isn't she? Or do I got them turned
We
around?
meet in Columbia City all the time.
Okay.
I think Sandra's actually.
You can reach out to Cheryl, she can give you the contact information for her, but
Because
there's 39 pages of, yeah.
Nick has an additional comment currently also.
well, to back up what I said previous, to be consistent, we need to cut the Manchester Museum in half too.
What?
The Manchester Museum,
I thought we did.
no, we didn't.
So he would
Yeah,
be
that's
saying 34,001, a reduction of 2,500. Third from the, of the threes,
Manchester Center for History, you said?
correct.
It's 5,000. It's all 5,000, okay, yeah, we need to cut that, you're right, Nick.
Good job, Nick.
That hurts.
That makes it right.
So do you add
You can go down
2,500 to Somerset since we?
We are even now.
Good, good.
We have to make sure that we don't put any more in than was advertised.
No, it's in there.
So is everybody good with this, though?
No. I guess I would bring Grow back up to what they requested. And where's, Visitors Bureau, where are they?
But visitors, we
fixed that.
we corrected that last night.
We brought down Grow to match the Visitors Bureau,
Yeah.
there was discussion on that.
What was the other one you said, Dan?
No, those are the two. If we didn't do anything to Visitors Bureau, then I'd advocate for leaving.
I'll pause here. Tennille's just walked in the room and we'll let her look at the screen. The screen you look at, Tennille, is a 2-minute delay. While she's looking at it, do the commissioners have any comments about this?
I have an awful lot of ink on my page right now. By me.
You have what?
I'm trying to make notes and I made an awful lot of ink all over my page. So
I'll just reiterate what I said the other night. We're the lowest paid economic development person in the 11 county region. And I would hate to see it go down to any lower than what we've been paying.
Jeff, can I ask a question?
Yeah,
How many of those other 11 counties have investors that are invested on the side? How many of those are just county funded only?
I don't know the answer to that.
Tennille will know the answer to that.
Yeah, they still get private phones too.
Specifically about Grow Wabash, is there a consensus?
I think they do good work.
I'm not saying they don't do good work, I'm just saying with everybody else, how can we leave them there and You know, all we did was equalize them with the convention barrel. And, you know, we have all said, Jeff even said, the tax, because of Senate Bill 1, the amount of tax work is gonna, you know, abatements is gonna go down.
Refresh my memory, Shelley, is that a contract or not?
Yes, they are contracts.
That they said when you signed it, that Mark didn't review, that could be adjusted at any time.
I know when it comes up, it's not just automatic renewal.
It is an automatic.
Oh, is it?
Unless you guys would not get the funding and then that you would have to renegotiate with them. And she said something.
Tennille, go ahead. I'll open the floor to you, Tennille, if you wanna take a couple minutes. So you're hitting back there a little bit.
I had to go to a museum meeting. So I missed the discussion. Tennille Zartman, Wabash County. In terms of cuts, yes, we're on a contract. It automatically renews if there's no changes with the commissioners, but you can change it anytime. With notice, I forget what the notice was, 30 days or something.
Yeah.
We negotiated last year. No, I would just say as you're considering, I understand things are tight, of course. The one thing I'd say in our defense, and then if there's anyone else I can defend there too, but with economic development, our job is to bring in more revenue, right? So I understand that things are out of your control with legislative changes, FE1 and what that looks like, and but my job is to bring in new jobs. New jobs bring in new property taxes, new jobs bring in income tax. The only way out of this situation is to grow our way out of it. So just think of that as you're talking about cutting in economic development. That's, you're cutting your revenue stream. We are your revenue department. So.
Right, but what if your goals are in the wrong direction? We don't need more businesses if the people aren't gonna live here. And we've had a housing shortage for the last decade.
I just came from a housing meeting just now, for 30 units. We just announced another 35 units. There's a new initiative that just launched in Manchester. We're working on an infill project. We've got 100 units starting in Wabash, and we're working on the GDX site. So we've got 6 housing projects going right now. That I spend a lot of time on.
Projects for the people, is it?
There is actually, the 31 is an LMI. It's income based.
Okay,
That's why I had to go, because it was
okay, but I'm
opposition.
talking about the Great American Dream. You know, $350,000 houses in Center Heights doesn't help that young 30-year-old couple trying to raise kids. And I think that's where we've been misguided. And there again, we're still $1 million away, so I don't think $10,000 a year is gonna kill you when you got all these other investors.
Yeah, and then at $10,000, just look at the contract, see the list of metrics I already have on there. I do staff 4 of your groups, 4 of your commissions, so some of you serve on those commissions.
So it's hard since it's hard for me to say much since it's been equated to what Visit Wabash County is getting. So the only thing I can really say is that I think that rural Wabash County is doing a good job with the money we've been giving them.
We've had record breaking
With
years.
what?
last
With the
couple
money we've been giving them.
Yeah, and if I can work with you as we determine what the actual shortfall will be after the legislative cycle next year, because I'm still hopeful there'll be some fixes to make the budgets a little better. Make those my targets. How much money do we need to bring in new property tax? How much money do we need to bring in new jobs? Let's not tax our current residents. Let's figure out how to bring new tax revenue in and make the government partners whole.
Well, we see it. I mean, I see it. I mean, look at how many projects are going north of 24 right there and 13. I mean,
Count the cranes.
count the crane. I mean, I see it. I know you're doing it. So I'm an advocate for leaving it at what it is.
Mr.
It's
Mize,
one of our revenue producers. I mean, she's a
Nick, to
rainmaker.
move it along. Where you?
I'd leave it the way it is.
I'd second Miss motion.
And Mr. Dillon's kind of trying to walk that line. I realize that.
I think they should get 85,000.
I need clarification. Are we talking about 75 or 85?
They are saying 85, 85, 85, 85, Brett. Where you at on it?
75.
That's where I'm at too, and I'll tell you why. You know, you guys walked in here and said custom cartons qualified, and I questioned you, and then they pulled it because they didn't qualify. Then you walked in here with the scorecard and we're gonna award points for people joining Grow Wabash County to qualify for assessments. That was a conflict of interest.
That was
And
the
then
report
I
for
really
15 years.
didn't appreciate, and
And that's-
you know, 5 minutes before a meeting, you walk in here and hand us paperwork that was due 3 months beforehand. So
That was the first time I'd seen the paperwork. as well.
George's dollars.
I'm not
That
saying,
wasn't unusual. That's not, that's not a.
That's,
well, there
I'm
again,
actually not legally allowed to see it. It has to come to you all. Then I can see it if I.
You're the
can.
tiebreaker.
like I said, I'm at 75. I don't think we can.
What the custom card, that was because of.
That's the legislative changes. That's what it is. Yeah.
Kyle, you're a tiebreaker.
So there's some clarification. Nick mentioned, he meant leave it at 75. So since it's been divisive, for 2027, I would say to leave it at 85 currently. So that'd be the fourth vote.
And with that, for my 27 goals, let me help make you guys whole, right? Let's figure out what the shortfall is. That's my new targets.
Yeah.
So I got a question, Neil. All these housing additions that you're talking about, these 6 projects, how many realtors are gonna be involved? There are a lot of projects that go to 1 or 2 realtors in town. So are you gonna get more of the community involved to spread that out?
Well, 2 of them are rentals. So the low income rental properties, the apartments, which is the project I'm personally working.
So are you gonna have them be property managers of it?
Yeah, both developers are property managers. So they keep those investments.
So what about Legacy Heights? How long is that gonna sit there?
That's under a lawsuit and I'm not involved with that project, so.
I
I
thought
would
you
like
guys
to be.
were. Aren't you guys the ones that brought in the Chicago developers for that? You and Imagine 185?
No, those developers are out of Fort Wayne. It's a nonprofit group that Parkview gave the land to. Had nothing to do with Wabash County, had nothing to do with.
And to the city. And the
No.
city, yes, they did. They gave it to the city and the city gave it to them, follow the trail.
Well, we're getting off target. I disagree. I think we've cut everybody else other than
Yeah.
the convention bureau. I think that it needs to be across the board. I mean, everybody needs to put a little bit of
So I'm
skin in the game.
are you confusing me with the convention bureau?
No, before
it-
you walked in, we
Yeah,
had you guys
sorry.
at the same.
Gotcha.
Well, I think just to keep moving the meeting along, there's been
Thank
more
you.
that speak to this item.
We have
to take 10 out,
Just,
like down here at the bottom, or.
okay, remove 10,000 from sewer projects, please.
Those housing conditions don't need sewers. I'm being facetious.
It's to keep we can't go over the budget that was advertised, so by.
Okay.
Something.
Next would be Cume Cap, 1138.
One question.
Oh, I'm sorry.
Back last week,
Yes, but
don't anybody shoot me, but what percent of increase are you giving the employees?
We don't know yet. We don't know yet.
Yeah, we're,
Okay, could you put
in the
that
budget, there's 3%. But
and we've over the years done anything from 0% to probably exceeding 3%. But 3% is where we advise the department heads to put in and the commissioners to put in their budgets for us to consider and look at currently.
Cause if you're looking for $1 million, you probably can have to.
Well, that's, one reason we're being tired of the normal is because we want to give raises. I think that was stated earlier.
Give raises.
Yeah.
I'm not suggesting you drop it to 0 by any means, maybe 2.5. You guys gotta come up with a lot of money.
1%'s around $128,000, and when you're looking for $1 million, that's a spit in the bucket.
that those conversations will go on throughout the night on what we decide. So, it is.
Okay, so we have 11:38. So commissioners, we currently have 600,000 in this budget.
That's where we're putting your maintenance project, 600,000. Spend that and come back. I mean, that's, take your list and start at the top with your priorities and see what it gets you.
Yeah.
So again, I see this, and one reason we felt to place it here would be to illustrate a commitment long-term. Being like 5 years, to get a good comprehensive capital plan. Get the punch list that Rhett and you have spent hours and hours.
And
going through.
Rhett, we need to give you some kudos for coming alongside Cheryl and some others doing that. That's what we've been kind of looking for years, and we're just thank you that you did that.
So all the commissioners, they did the legwork to get it all started.
They said it was all you.
Well, I'm bigger than them, so my vote counts for more, I guess.
It's not based on weight.
Oh.
Okay.
Glad you're good with me. That's all I need to say.
So if there's nothing there, we'll move to the A action, 11:48.
Does the Grove Foundation do something with cigarettes or smoking?
So some of the,
It's the drug-free budget, drug-free, that's the name of the fund. And it's set up by the state. The clerk actually collects that money from, I don't know who pays it, probably felons.
so there's several different discussions about several of these line items.
They do go through a grant application process.
Does this group have a board?
Yes.
Who's on this board? Are you on that board?
Brian, what's your interaction with them?
Tricia is on.
Tricia's on the board.
Tricia Haynes.
Trisha, the sheriff, there's like 8 board members that review the grant applications, approve them, and then it was Dan Gray, I'm not sure who's taking his place. He then submits
Tobacco.
that list to the commissioners, and they review it and approve it, and then it comes to you guys to fund.
The question I may have for Tyler on New Beginnings, do you know what that may be used for in the past?
I don't recall.
I have that grant application downstairs.
I feel like there were a few different things. One of them, I believe, was like,
It's a great thing.
One's under treatment and one's under admin, so it must be education.
Yeah.
Do they do some education?
Education was still up where I'm looking for curriculum, literally some type of curriculum materials. Joe was using to go through those guys. At least part of it.
Is that the outfit? Maybe I had these confused. Is this the outfit that you're on the board that?
It's New Beginnings, it's a men's recovery home.
Okay, let's put that back in.
It is significant too, because we are purely donor funded and.
I would be in agreement to restore that to the full amount. That's why I asked Tyler, since his connection there.
Yeah, I'm good.
And we can't take anything out of one and put it in the other. All we can do is cut it, right?
Yes,
Correct, you cannot move money around.
they have an application process.
Okay. I'm good with the rest of it.
Cheryl collects it.
Where does this come from? Where does this?
Yeah, Cheryl, do you know where this money comes from?
No,
No,
the
the action.
1148, the drug-free fund, you collect it somehow, Cause it comes in off of your collections report.
You're on the spot now.
Yeah, I am. Well, I'll have to look at that.
There's nothing else there.
It's a drug-free community fund. It's funded by IC code 5211. It was established using 75% of the drug. The fees collected from the clerk of court for local alcohol drug abuse prevention.
Okay, so we're collecting the money locally. And the state is giving us reimbursement and we're gonna say, what?
No, that's the
No,
fund.
we
It comes
collect
in.
it and it goes into our fund.
Comes here, stays here.
75% has to be used for,
Drug or
Drug.
alcohol.
yeah.
Okay.
And then they have like 4 categories. When you look at that action thing, there's 4 categories across the top. And they have 25% of their funding at each one of those 4 categories.
It's probably part of the report cost that they're assessed.
Yeah,
Yeah.
and it's a,
Yes, Brad.
So in line item, WC drug court testing costs.
you guys are a recipient of the grant.
Yes.
Yeah.
This can know that.
Yes.
So previously, I just pay the straight from this line item.
Okay, yeah.
Because they're.
But the
One that
numbers
Brian
that I
said?
got from Tricia don't match up with this.
The dollar amount?
Yeah.
Okay.
Which line item?
Which, yeah.
Kimberly?
Incentives,
I believe.
the 21207 incentives. She sent me $4,000.
You sure that wasn't professional services?
Could be.
I mean, that's. For a line.
I have a total on the award grant, $10,000 for Wabash County Drug Court.
Yeah,
No. Oh, yeah.
that's what I
Yeah.
have. 6,000 for drug screens and 4,000 for incentives.
I
We
have,
didn't make any changes on that.
no,
Yeah, so I don't.
I assigned the numbers. And it came in. Under professional services. And I thought I emailed you and asked you.
Okay, so the professional services is due to, okay,
And-
I did, it just wasn't.
Yes, that's the incentives.
Yeah, that is
So-
motivational resources, is
Right.
what it says on here.
Which Tim was looking for in line 21 something.
Yeah, yeah. And then needed supplies and resources to accomplish purpose is 1,000 in the incentives. And 5,000 in 3004. Drug screens.
So, do you guys subsidize drug screens if they're in drug or whatever the benefit of that is?
Explain what you mean.
So. Don't the participants in the whiz quizzes have to pay for them?
They do. The people in the substance abuse like recovery courts, they pay a lower fee because they take so many of them. So yeah.
Okay, yeah, so you are subsidizing.
Yes.
Okay, that's all I wanted. Yep, that's fine.
Okay.
So he changed the description in that 3,000 or 30,000 number up, down. Right? Yeah, call that something different. So we know.
What would you like?
So
You read
everything,
it.
everything else that I've seen
Something in
for
there,
is
motivational.
It's like motivational resources.
for screens. I always use the drug screen 3000.
I could put it as a supply item. I mean. We don't have an account code for motivational resources. I just had a big.
Oh, okay.
Because.
Just
I mean,
put
that-
slash motivational, so they
Yeah,
know what
put
it
a
is.
slash, there you go.
So they know what it is. Yeah.
It's just.
Yeah, but you know that it's professional services slash motivational, whatever.
Resources.
But so the screens, sorry, back to the screen. So I got 6,000 is what Tricia sent me.
Yeah,
Um,
5,000.
I gotta. I'll have to look at the email, because I know I emailed when I got the grant award. And so 1,000 was for incentives and 5,000 was for the screens. So
Did they do two?
we can do,
That they requested it, in two different categories.
I can pull the grant applications tomorrow, and if you, I mean, you got the money. And we can do a transfer if we need to.
I'm comfortable with that. It appears the 10,000 is there, just may not be assigned the right account number or line item, so I'll rely on the auditor and Kimberly to figure that out for us. Next, we have the 04 fund recorder. No changes here. 1154 enhanced access. $1160 security protection. And then 1189.
Yeah, this is the perpetuation, so I did not look to see if there was no unbudgeted, because he doesn't even have to actually budget it. It's a courtesy budget.
No, that's fine. So the next would be the plan commission. Yes, no, Mr.
I hate to cause any more complaints in time, but the Wabash County active money, $6,000, it looks like it got cut to 30-50. It's usually used for overtime and drug investigations for us.
No, that wasn't cut.
I didn't see that.
Maybe
I see that on this page back here, on this back page, right before it's close to the
The
designer,
overtime enforcement
overtime enforcement.
was budgeted 10,000, and it's in the 1 and 2 line items.
Yeah, it's up top.
Because she pays it right out of payroll. There, the first 2 lines for that 10,000, that's the overtime enforcement.
Oh,
It actually went up 3,500.
yeah.
Well, I know we can cut that.
Connect to that action grant.
No, that.
It is.
There's an action line item on there too, that you guys got,
Oh,
and
I see what you're saying.
We had the exact same question because we thought somebody at Action was getting paid $10,000. And then we were informed it was for OPO or your officer, so we left it.
Tyler, we're good. That's
Tyler.
Gotta have my money, right?
Okay. But thank you for the question,
Yeah.
because I forgot to cover it. Location 22, Plan Commission.
Didn't we get an answer from Jennifer?
Yeah,
Did we
we
make
put
that
it in.
adjustment last night for
Yes.
2950?
as you see, I moved that up into that software line item so that you guys would know it's software. And then if you go off to the right hand side, I took that 2910 and out of to go to the 1207. Per that letter she brought over for you guys,
Yep.
as you directed.
Go ahead and move to the 1207, as she's indicated.
No, I don't think I actually went into their fund and put that in there. Because I didn't know what to take out. It would have to like come out of the 2,500 probably. And she can use that number, she can just transfer it down. And-
Yeah.
We can leave it as it is for now, and if you work with her.
Yeah.
Do that. The new 1240 fund. Did I make any changes to this new?
They haven't spent any money in the last 3 years.
Well,
They haven't collected nine in the last.
Yeah, thank you, Matt. You had me on, yeah, you had me go there for a second.
03 in county general.
I'm
treasurer.
ready to go to Matt.
Yes.
Yeah.
Unsafe premises, waste of professional services. That's what. that's
If they
what-
would have to tear down a house,
And we have,
they contract out to that person to tear it down.
And the goal is then they put a
lien the property.
lien the property to hopefully get part of it back if they can, if the person's alive.
I think he said the other day, there's like $40,000 if they're owed back or something like that.
We are currently collecting one under a garnishment order, so. I mean, it's one.
What? No changes here. Moving on to solid waste admin, 1194. Next, we have probation.
Let's do it.
I honestly can't remember. Did it end up in?
We moved it around.
We moved the salaries to
Unrestricted.
Oh, I'm so sorry, I wasn't.
So in probation, the 20%, there was discussion whether or not to take it out of user fees or unrestricted. Opioid,
The
and
unrestricted.
it went to unrestricted opioid.
So that whole person is in
Yes.
restricted and unrestricted.
But in
Both of
opioid,
them. The only question, yeah, I'm sorry, yes. The only question I have on that is the insurance cost. Because.
where was it before?
I don't,
usually stayed.
in the grant, I would assume.
One came out of general fund, county general fund, and one came out of a grant in our community corrections project income.
So the question is, this, normally we pay benefits out of the same fund. I just need you to direct me if I need to put it in the opioid fund.
Yes,
Okay,
Yeah.
that's good enough for me.
so we see it all right there.
So when we get to that budget, we'll adjust it. I would just need to know the level.
Yes. Oh, you need it.
No, I mean, that. That would to me.
Oh, I know, it's,
Didn't we have the salary in there? It was two
It-
pieces.
She was in the general fund, so it just went into the big.
Oh, the pot. Oh, for the bennies.
Yeah.
Okay, so
Do you want that from her now, or you want her to?
She's getting it.
Okay.
from,
Do you?
both of those will be employee plus children.
okay.
Any other questions here with the 037 fund? 1122 is community corrections. If there's any adjustments here for us to just review their account, it's noted.
The state does look at that.
We'll go pretty quickly here. Well, 2100 first, we'll stay there for a little bit. That would be the adult user fee. And 2100.
And then the two that I removed. I did move the group health in there because,
Yes, that's another employee.
okay, I wasn't sure.
Yeah, that is one of their employees for no.
Okay. So would I need to make this number for the other two?
Correct.
Okay. Each?
Yes.
That's all screwed up.
We'll have to see if we can.
No way they could be one person.
Oh, yeah.
That's how much. fund
Oh,
pays.
when I did the math, it was per
You're right.
employee,
Yeah.
but still, it should, some math ain't right. But,
We can talk math later.
yeah. I know.
2150,
Maybe housing.
You don't pay for
I'm
community
if they
credit,
don't,
so we
I'm just looking at the screen because it's got all stuff on
I
already.
know, I'm just still.
How much the health insurance is?
Yeah.
Yeah.
So my 14,000 earlier was way off.
Yeah.
Yeah.
That's just what the complaint.
I would say, I thought it was like 30,000 for a family and 19,000 for a single employee, doesn't that sound closer to Cheryl?
Well, we have some in
I
place.
think that's what you were talking about.
yeah, you took it to
I took-
employee base is
Yeah.
what we're taking.
Yeah.
So, Matt Mize is referencing earlier his 14,000 number cost per employee. That's if we were to take every employee electing to take health insurance, which some do not, take health insurance.
Yeah.
Because
It's even more than that. There's more. I don't have, there's gotta be a traditional plan.
You gotta come.
I asked you about it. I asked if there's a traditional plan. I'm gonna go get insurance again.
Give us a quote on a traditional.
Yes.
I think, wasn't Marcy working on that or something?
He was supposed to.
Yeah.
Okay.
Huh?
Well,
Oh, I already,
on that,
that's
if we do
exactly
move
what I
to a
thought.
traditional plan,
That's off the record,
the
sir.
reserve can be used to pay the premiums next year.
We'd have to hold that for a certain period.
Yeah, there'd be a lag.
Sorry, I don't want to be a voice of reason.
But it may bias, yeah. So 2510, or we did juvenile 2150, 2510 alcohol and drug. 2511. Drug court, 2000 adult admin, 2050 juvenile admin.
You just pop their malls, you didn't make any changes.
Oh, okay.
No changes.
No changes. And councils will use these now 3 times. You can make changes.
You want to change?
That's.
Why do we have adult probation, juvenile probation?
They're all made by IC code and they're required to only spend on certain items.
It's just the way that.
We don't like it.
And they're collected a specific way.
We'd rather have just one account, but we can't.
And Cheryl would rather have less.
About drug court, the other one, I mean, we're not making any cuts here.
Well,
There's nothing to cut here.
Look,
It's not our money.
It's not our money.
zero.
These ones are fee based. They collect it, they spend it.
Yeah.
Yeah.
I-
This is just
I
a
don't know.
courtesy.
These are kind of like our savings accounts. This part isn't the county general fund.
So it won't help our.
It won't help our-
I'm not gonna save you.
We just have to review them, dude.
Well, like I said, we just put. Stuff in the opioid fund and the other choice was to put it in the general fund for benefits, so why aren't the benefits in here? If it's their money,
It actually came out of the county general. There was already one employee that was in there and her health insurance.
and now it's in this,
And now it's in the opioid fund.
We took it out of county general, put it in the opioid.
So save like $100,000 just for her.
okay, thanks.
Thank you for doing that.
So we've reviewed previously solid waste.
Pretty good.
Is anybody need to touch on solid waste again?
No one wants to touch that.
That's why I said that.
Weren't we gonna ask the commissioners to talk to them about tipping fees or something?
Yeah,
Yeah, they were here. They were here.
We're looking into
Yes.
That's the general feeling now is to go with dipping fees rather. Nobody wanted to increase that user fee.
no, it'd be nice to be able to get rid of that.
Put a fee on it to get out of their. car.
034.
Our user fee, and I don't use the landfill at all.
Yeah.
34 public defenders.
Well, there we go. Big guys, somebody back.
We just adjusted them up to 3%.
We adjusted them to align with the current 3% recommendation. Next, council's budget 030.
It stops. You just.
And not take a raise this year.
No. I'm not-
Took our raises.
No. I mean, I tried to do that in the past. I mean,
Yeah, I'd be okay with not increasing our own, but.
Yeah, take our raises out.
I don't want. Zero our raises out.
I've heard from a majority of council members to lower ours by 18,727.
You just saved a ton.
yeah, that's the difference.
We just saved our million.
Yeah.
Thank you for doing your civic duty.
Somebody must be around for all.
It's an election.
Did we just cut the commissioner's rates too?
We haven't got there
Did
yet.
We
you?
haven't got to those yet. Got
Oh, there's up here,
We're leading by example.
Pastor.
We get paid for this.
Okay,
Wow.
there's nothing else there. We'll move on.
There's the second one.
Central dispatch, we have fund 1222, 911 fund. Outside of county general,
That's true.
I didn't look.
Yeah,
This
yeah,
is
no.
straight up off 911 fees. They get 40,000 a month. They can only spend it on a certain thing and they report to the state.
then we go to PSAP 1235.
No asterisks.
Sometime, yeah, I don't believe the auditor had the time to review this one for.
General,
Yeah.
where you put the asterisks, right?
Oh, I did not. I only did the county general
Okay.
because this won't help our levy.
No.
1170 public safety. That may actually be later on,
That's
so
later.
we'll continue. Soil and water. There weren't any changes to soil and water as she scrolls there.
Just a note to the commissioners, he did say that there's a tractor and a mower.
Actually, I talked to Greg about that today. That mower and tractor gets used to mow the back county property and areas and. I was told maybe there's a couple other items in that barn, but Greg and I will, and Brett, he doesn't know it yet, we'll go out.
I got my time. I'm out. I signed off.
Talked to him a little bit about that. We're gonna go out and take a look at that building here.
We did buy that equipment from them.
Yeah, they said yesterday that it was
Okay.
our equipment, so, but Greg does use that, so it is.
Emily, next would be the assessor, 010. I don't see any
If we don't have an assessor, can they assess?
She's not here to
Yes,
say.
Nick did say that yesterday. Nothing against Lacey, but the only way we get taxed on our property is if they assess it.
I put the same step in it.
Yeah, maybe.
Peterboa, we had no changes to 023.
Now, next year, they said there will be a change because they're gonna have to go 2 days. So it will be double that. Oh, yeah, will she increase it?
No, she said she was okay. She currently thinks she can boil it. How is that?
I thought she said this year she was gonna have 1 day, next year she's gonna have to have 2.
It's budgeted at 2.
Oh, okay.
It's $100 per the 3 per day.
Okay.
I gotta swear them in next Friday.
Reassessment 1224.
This is a tax credit, so.
Yes, so even this is, even though this is outside county general, it has its own tax rate. Property tax rate, clarify.
We're in 1224.
Yes, 1, 2, 2, 4.
And when was what?
Yeah, 157,000 if we have level 3 certified assessors.
because we have some sort of.
We bought 3 cars.
Why do we have 3 people in there?
Because they're training
Oh.
one to take Chris's spot.
Then John Deere.
And then when Chris retires, they're not planning on replacing her. But it takes like a full year to
A
get,
full year to train.
because they only do stuff once a year. Just like some of us.
Just once a year.
12,
We're going for other funds.
Just like-
12/24 reassess.
No, because yeah, we don't. Yeah, there isn't anything that is asterisk on in here.
We haven't seen any of this for a while.
Then we'll go to, we reviewed the county sales disclosures already, 11/31. So we will go to the courts, 035 circuit court.
We can't read it, what raise do we got?
No change.
There's any raises to the.
We didn't change their request.
Right.
There is one asterisk.
Oh, there is one.
Please don't.
Travel mileage? Does he never go anywhere?
The only thing I have to say is you're gonna have a new judge. So he may. She, I apologize, I didn't mean to read.
Wow.
Right there.
Way to be.
He or she may travel,
Only men have put their names in the ringer, from what I've heard, so you were safe.
okay. That person may travel. That's all I have. I mean, you can do whatever you want. I'm just. New person coming in.
They're not gonna travel.
They can come ask.
Okay. It's Totally.
Keep them in the county, get work done.
If there's nothing else there, my council, Superior Court.
No asterisks.
There would have been one. But it's for the
Training for the
public council
Hopper.
consent.
Oh,
How do you say that word? Yeah,
Hopper.
yeah. And I know you have to have that just for when they're.
We reviewed CASA, the 4212 and 8212 previously.
Yep.
There's nothing with this outside grant matching situation. We'll move to Purdue Extension 020.
I need 2 minutes.
I won't call you Jeff, right?
Okay.
Let it,
Jeff, you wanna come up here?
It'll just be a minute before it comes up too.
Can you may I just turn around?
Yeah, you can. You change the name.
Okay. Thanks for changing the name for that. Bottom line, well, first off, any questions for me in terms of that?
What's your reaction on that $40,000 cut?
So that 140 number is not my number, that's Purdue's number. So if it is changed by this council, it goes to Purdue and they're legal and they deal with it.
And Dave, just to piggyback off that, I did talk to Jeff and I talked to Superior Bill, who talked to his superior today as well, to get feedback on the situation, and that's in summary, real quick to the point. Purdue's gonna come back and they will have a list of potentially where the reductions are gonna be as far as services go. Let us notify us of that. I expressed the bill, expressed to his superior, who's still below the chain of command, that we would like it to be an ongoing conversation, not just a drop the mic situation. So with that said, there was clarification about Miami County also, their request.
They were requested to increase by 80,000.
So where we were.
Is that based on the population matrix?
So their number is similar, if I remember Bill's. So Wabash basically was following the policy as directed. So our change in numbers from 2026 to 2027 was what, $3,500? So that's normal, but every county is different, so I cannot speak to what other counties and councils have.
So is the 140 based on our population?
Correct.
Okay.
Yeah.
And so Miami County currently is facing the decision on whether to fund around the 140 level. I don't know if they've.
There have been whispers, but I don't want to put anything on the record.
No, that's.
What do they use for the county count? Do they use the last census?
I believe so, but they've updated it because I forget when Bill said there was a formula that was pushed out many, many years ago,
Right.
and that with our new.
You explained the last thing.
Yeah.
Jeff, I just want to be clear, this $40,000 reduction does not reflect how we feel about you or the office.
Absolutely.
Yeah,
This-
not at all, right, yeah.
But I think it comes at a good time where we should be accountable as Purdue Extension to our county.
Yeah. Our thought process behind this was, hey, we need to get Purdue's attention.
Yeah.
And say, one, what the heck's going on?
Yep.
What's your plan? I understand you guys kind of laid that out. But there's so many unknowns and Purdue needs to answer to that. So.
No, I think this is a great time to be evaluating that, so.
And the demographic of the county has changed too. We're still a farming community, but
And we're moving with those times with
Yeah,
the different stuff.
Yeah.
We just want to make sure that you're getting the services, but again, all over my head, if that's gonna be a change coming up, my position changes quite a bit. But that's okay, because we're dealing with it.
Changed about every year for the last.
It's fine, it's fine. We'll
do
get
you
through
think
it.
that number needs to be bigger?
I would,
To really get their attention?
I don't want to.
I think you got
It's because my, yeah, yeah, you're. The thing with that is, I'm a nobody. I'm just supposed to provide programming, so that's where I'm.
And that's where I think Sam is right. We love the programming that you
Sure.
do and that you're here. And we know that they're the ones that are taking you and kind of moving you, and we know that.
I will say this with Bill, my new ROL, we're very lucky to have him. But by January 1st, I will no longer be CED, so he'll be here and not me, and I won't have to worry about it.
Well, that's.
But keep
That's why we're pissed.
keep the communication, no, keep the communication up, because we've had quite a few. A lot of our program is successful because of the county partnership. It just is, so. Go from there.
Does anything change on the 4-H extension side of things?
So as Bill said, no, not really.
Okay.
Now, will this change?
I wasn't clear
something?
on that, that's why I'm
This
asking.
might change something in terms of, cause like we have our contract that we give to the commissioners to sign each year. I don't know what legal's gonna do with that. They've been down this road before. So I have not. So.
I appreciate your time.
I know what they think, if they're signing the contract.
You guys have comments currently?
I mean, I appreciate
Yep.
everything you've done.
Me too.
I think
Get to
that,
know a guy and then they take you out.
yeah.
And I appreciate you being here for 5 hours and 15 minutes, so.
Oh, no.
Or 3 hours.
I work
Can't
here.
do
That's
math.
fine.
5 hours.
Yeah.
How long have I?
And then,
Let's move.
yeah, if we're good. Other questions? My office is still right over there, so keep in touch.
Thanks, Jeff.
Is this, I guess I just need to be in touch with Bill. Don't send anything to me. It needs to go to Bill. I can be carbon copied on that. And I think I've given you that information, so.
Blind carbon copy or.
Yes. No, great, thanks, guys.
Got it, thank you.
Yeah.
Next, we'll move to the sheriff's budgets. Current sheriff, Mr. Baker could not be here tonight. I did have some discussions with him right before the meeting. Probable sheriff-elect Gannon is here.
Yeah.
That's again. The discussion here, currently how it's filled out, Tyler, so it's hard to see, but we have kept the captain's stipend in there. So we kept the captain's stipend in there. But we have not increased the overall head count within your department. So now it's at the sheriff or sheriff-elect's, actually sheriff-elect
Discretion.
discretion to decide.
To either have a
To
merit,
create that position.
to either be a
essentially,
merit deputy or.
within the ranks, yeah. Okay. It's fair.
Which our thought process is the sergeant's probably gonna move up and then the deputy's probably gonna move up and then you just got one that you don't get to fill. But it's your choice.
Keep it right there.
You can do either or, cause the money's there.
Oh, there are some things that, yeah, down here that we need to make sure to go over, keep going down.
I do have one other thing I want to discuss. I discussed it with Kyle
Oh,
and
sorry,
Sam.
this budget.
That's in this.
You can go ahead and do.
No, it's in the next one, isn't it?
Okay.
Yeah, it's in.
Yeah. So a few of these we're just trying to get them, every year's a moving target.
Of course, you know that if you need more gas, we're gonna give you more gas. It's just. When we looked at what was spent year to date, that's where it kind of landed, so.
And you can take pictures or we can show you tomorrow.
Yeah, I can print them
Next over to Baker right away.
tomorrow. I'll pick you up tomorrow, like, go to me, have them all, but it'll take a little longer to get an individual.
Anything else here from council? I'm trying not to rush, but I'm still trying to work through quite a few accounts. Next, we have jail.
Who wrote the vehicles? Where's that?
Public safety.
The same thing.
The aspirates are the ones that have been used and there's some we already moved.
And three.
In
current
3 years, it's not just like this year, it's been 3 years.
Hey, since Tyler's here, I have a question. I don't know if he answers it or if it's Shelley. If like the jail guy that had 300 hours of comp time last year and we paid it out. When they work over, do they have the choice to take overtime or comp time, or do they have to take the 80 hours of comp time first?
They currently earn comp time.
Yeah.
If you want it to be overtime, then you would have to specifically say they can pay overtime. They've done that in the past and
Yeah.
certain,
Extreme.
We did it last.
certain extreme. They have overtime budget, but that's for the people that work on holidays, cause they get
Right.
time and a half. Because they're 24/7.
They still have the option.
They do not right now have the option to pay overtime unless you guys would
It's
say.
almost strictly comp time unless there's a
Yeah.
special
How much
situation.
overtime do we have in here for him? 20,000?
Yeah.
So,
Yeah.
I mean, they do have a line for it, so.
It's because they work on holidays and they get paid overtime for it. Cause for every holiday, they get what's called halftime,
Well, then I
which
don't-
is overtime,
But
and then,
I think if we're gonna make this policy that they gotta use it. Why can't we just pay them when they do it, the overtime? So we're gonna need to give him more money to do that. I mean, I think, if I work 50 hours this week. I might say, I don't wanna wait for those 10 hours later, just pay me now.
Well, that's.
But that would be a paper, you guys have to have a different. Way to track that.
That's what I'm going with. This is the benefit of, if a guy's got kids and he wants more time off. During the summer, he can go ahead and take comp time when he's working in the winter time when we got all the action.
Yeah.
Or if he needs some money, cause he's got a kid going to college, he can take
use comp time?
What?
we use them
How
as
much-
a line item, because they're
Do
short
they
staffed.
use it?
So we
Or
use
you
that.
guys short staffed and they're working more hours?
Well, it depends on where
Yeah.
that staffing wise, and it varies between merit deputies and jail officers as well.
Right.
This jail officers, I don't know if some of them may be more inclined to start cashing out. Because a lot of them are younger too. I mean, we have demographic wise, I feel like it goes either from really young to then. But as they age, their time's more important to them. What if they start having families?
Yeah.
But a lot of the younger ones are gone within 3-4 years at most.
Right.
So then you're just back to another young face. So it could vary. Merit deputies, I feel like they're more inclined to use their time because a lot of them, especially right now, we do have a lot of guys with young families, so time's more valuable.
And kind of where I'm at on it.
But if you had the option, they pick the option then, right?
Yeah,
I mean, would you advocate for the option or just leave it alone?
Yeah, that's what we're asking you.
I think for jail staff, it would be potentially a good thing.
I'd say put 10,000 more as overtime and let's work towards that. I mean, if I'm working overtime, I want paid. When I'm 23 years old, I want paid or.
Yeah.
I like.
Now, we are gonna pay it at the end of the year if they got more than 80, so.
They can live it, I mean, when they're
Right.
paying that, they have the salary for all the jail officers.
Right.
And then they have to pay it, they're short staffed when they move that money out of the jail officer line down to the overtime and pay it.
So she's saying they have it
So-
within the line items currently.
So they could transfer that down and pay
Yeah,
the
but
overtime.
I know that it would take a miracle, so what if all of his jail officers are here and stay?
Then they won't be getting that much comp time.
You just.
Well, that could be-
No, they get it because they're short staffed, because they
Yeah,
have
we should.
people,
And that was it.
yeah.
You got something. And
Right, this
All right, it's been balanced out.
I mean,
Last year, we have been doing fairly well staff wise. We've maintained a high enough level that it hasn't been as big an issue.
Okay,
But it just depends on, what really hurts us is if we do have like hospital watches. When we have inmates that end up staying out of county in a hospital, we're pulling 12-hour shifts to guard that inmate essentially. That's where it starts accumulating very quickly, and that's random though, you don't know when you're gonna have an inmate those ones that hurt. But it's-
Again, I'm gonna ask my question again, because I haven't really heard an answer. Is this a benefit you think that the county employees need, or at least the ones that are gonna work under you if you get elected? I mean, to me, it's kind of like the money for your years of service. If you have the option to work in the overtime and getting comp time, if time off's more important to you versus the overtime, it's a benefit. We just can't go over 80 at the end of the year if that's what we decide to do.
I'd say more than likely they're gonna be interested. I'd like to sit and talk with Ashley, our jail commander, and get a gauge on it.
Well,
I
yeah,
think we gotta work on it anyway, just something to think about.
yeah, for now, we'll leave it the same.
Yeah, and, yeah,
In the conversations about the comp time with commissioners, they will need to help decide that policy because we can't necessarily cherry pick on how we're
right.
gonna treat certain.
No,
And you'll have 911 or you'll have.
What I'm saying is we just offer it to everybody. You know, if we can afford it, what's the difference? It's overtime or it's comp time. Give them the option, just at the end of the year, you're gonna get paid out.
But that's good, more discussion that we have to do.
Right.
So we'll keep moving through here.
Okay.
He's got asterisks.
Yeah. We were wearing part-time jail pay. It'd be good to put that towards the captain's pay, full-time captain, new position.
We left it in there. The 9,000, hang on, mattresses. Rhett was in your facility, he said you got enough mattresses for a couple years.
Okay.
One, I didn't say a couple years. I said they were in the courtroom, stacked up.
Yeah, there's a few in there, there's my house.
Yeah.
We'll just reduce it to be consistent. If you can also scroll down to the 4,000s. The 400s.
I think the commissioners are paying for your fire alarm maintenance. Because I know you guys are getting maintenance, but it hasn't been spent in
Maybe the
3 years.
QCH.
Oh, it was on the
Well,
PPH.
Service contract. It's probably
Service contract.
part of the QPH. Preventative maintenance, 56,000.
So Tyler, on the van, we want you to buy it this year. In 2026,
Yeah, okay.
and then we want you to pay to outfit it out of commissary. Or move the partition. I will almost wager that you will get it done for less than 15,000. Cause it's coming out of your commissary.
And make sure you tell Baker he said that.
Not a lot of companies that can do that work. So I doubt that, but yeah, I'll let you know.
Oh, county misdemeanor fund, you could also take it out. Not your funds, county misdemeanor.
Yeah.
It could come out of there.
Do an additional appropriation
Oh, for the van itself.
for the van, for the 52,000.
So when he comes, because we want you to do it this year, additional appropriate out of the misdemeanor fund,
For
the van.
the van.
Yeah.
Okay.
Do you want me to email that to you tomorrow?
Yeah.
Did are we getting the cameras this year too, or is that for next year?
Yeah.
Yeah, that's what I thought.
Yeah, but I don't think we agreed to do that this year, did we?
Yeah, we did, didn't we take?
No, we were gonna start it
We're
this year.
Gonna start it this year, we're starting it the way.
I had asked about it to
Yeah.
bump the contract out.
Because it's a 5-year contract.
That's right, I remember now.
Thank you.
Anything else with jail, 33?
Was that the jail you said, or was that the?
Jail.
Snares.
Yeah.
So they have nothing for building repairs?
We have 40,000.
Oh, okay, oh, it's 80
And then-
and then 40,000, okay.
40, and then you can always, if that goes over, you can use that. out.
We thought just the coordination of bigger projects could run through the commissioners, but little stuff. Sheriff can take care of. Okay. Next, we have the 1101.
That was very restrictive, just so you know. I looked up that one to see if we could keep the fan. You have to buy accident stuff. You can get lights and radios out of that fund though. Just so you know.
The accident fund,
Mhm.
what's the balance in it? You go to the left, right, on the right.
35,000.
I'll buy like 2 radios.
He's new, he
Yeah,
doesn't know what any fund
In-car,
can do yet.
yes. Portables is like quite a few, not in-car.
Firearms, 1156.
You buy exactly what you think.
Have you guys made a decision on what you're buying yet?
Yeah, I think so. Potentially,
Say,
as of today, yeah.
1170s, public safety.
Was the one time, or have we got to the one-time purchase or not? They haven't.
It's still here. Oh, handguns,
That did not.
No, it's.
we're gonna
We
do it
want
this
you to
year.
buy them this year.
we would like you to buy them this
Buy 'em
year,
this year.
and the auditor has a place for it.
The auditor has that thought. I have to talk to the commissioners
We're
about it.
buying the guns this year.
Guns in the van,
Yeah.
and you have to carry all the guns in that van at all times.
It's a bad place to put it. You gotta claim something.
We found the fund for it.
Yeah, there's current funds.
So again, that's a this year thing, like 26.
So you know.
Okay, so
It's fine, it's not a problem.
Do they give you a trade-in value for your guys' current ones?
I probably would, we usually allow buyback for the guys, if the guys wanna buy them back, and that's pretty successful for sure.
Yeah.
And if someone,
Or elected
someone else will
council.
pick up the slack.
Yeah, because we didn't get a raise.
Say, let us know if someone does it.
Okay.
Get guns
So
instead.
when they buy those back.
Oh, on record.
That's a good question. I've
They haven't done it in 8 years.
It's been 8 years.
Yeah.
Yeah, because that would be like a general.
on motor vehicles, we created a line item for lease payments. And move that. Which they're gonna be done,
Fill
right,
That amount, that's how much you owe.
and what I'd like to suggest is, so we can get to our $1 million number, I don't know if this.
This.
Nope, this one doesn't.
But what I'd like to do is give you one car right now in the budget, cause we all know, we're not gonna buy a donkey and a bucket of oats if you wreck a car. With
Dave, that's not gonna help
well,
where we're at.
I understand that, but what it is gonna help is if we give him one right now, and if they go all year and don't wreck any. He's always asked for three, maybe we can buy two at the end of the year and get them cheaper when they put the 26s on. I'm gonna call it on sale, clearance. We might end up saving some money, and once he takes over, maybe he gets a VIN number. And we can buy them at wholesale, so. We're still giving you the same amount of cars. It's kind of like a verbal agreement, we're just putting one in there right now. And then if they have a wreck and we gotta buy one in the middle of the year, that's what we gotta do.
Yeah, that's what the addition.
So Dave is asked to reduce line 4430 down to basically one vehicle. What's council's thoughts here?
History tells us they need to cycle 2 cars a year, I mean, at least. How many cars you got?
We bought 3 this year.
Help, please.
Yeah, I said at least.
We already bought 3 this year. And then if we buy one right after the first of the year, that's 4. And then if we don't have any wrecks, we can buy 2 more at the end of next year.
Probably 30.
Yeah, I mean, how many years are you thinking they're gonna last, Dave? I'm just trying to.
Well,
cycle it.
there again, depending on if they use the matrix, according to that other guy that I talked to. If we send a car in at 100,000, change the coolant, the transmission fluid, the belts, all the hoses, you're spending less than $5,000. He says they'll run another 100,000 miles. Until we try it, we don't know, but I'd be willing to try it, cause 5,000 is a hell of a lot cheaper than 50,000.
I mean, we're running
running
to 170 anyway.
Right, but is that maintenance getting done at 100? Cause he's come in here a couple times and they had 140 on them and they were junked because. The coolant had overheated and transients got hot, I don't know what the answer is, but.
Yeah, I'd be inclined to leave it at 2, I mean, if they don't need it, they won't. Buy it, but.
I just leave it, I mean, given this newer vehicles. Aren't what they used to be, in my opinion. But
That's the issue.
yeah,
Sam, leave it down.
Or how about another idea? How about if we increase it? And have them go to something with full frame? Are any of these K9 vehicles?
my full frame, need like mid-size, like an SUV.
Like a Yukon or something, because the state guy says that we can run them 300,000 miles.
Yeah, then you're
I don't
burning.
think you're gonna get
You're gonna
any.
buy another car with that.
Well, and now you're not.
I don't think you're gonna get enough extra miles out of them to make the difference. And I just not with today's vehicles.
Let's just leave it alone.
I wish we could.
Too.
Okay, well, the consensus is currently leave it alone.
And this on the record, what I don't like is we approve the budget. They go buy, they go buy 2 cars and then all of a sudden, boom, somebody wrecks the car and they get rewarded for wrecking a car and they get a brand new car.
It's part of their job. They gotta have a car to do their job.
I understand that. I'm not arguing.
It's, okay, let's move on to this.
1175 misdemeanor.
It's the matrix. Are you just buying a car because it's got 100,000 or are you looking at the one that's causing the problem? That's why I'm trying to go for.
And this is where she referenced the cash
So we need
balance.
to put we need to put a car in there?
He's gonna initially
I mean,
appropriate.
the
everything.
oh, this year.
Yeah, because there wasn't enough advertised to do it. out
Yeah,
there.
yeah.
4204 sex offender. We had no changes. J cap would be 4208.
This is a donation fund, so.
Moving along from the donation fund, we have 4210. Reserve deputy.
Oh, that's the money that they collected from working at the fair. And they buy their reserve supplies out of it.
Do those guys get paid or do they get a stipend or?
They're volunteers.
Oh, I know they are. I mean, I knew they were volunteers, but I know EMA guys get a stipend for something, don't they? Uniforms or?
Um,
We have.
They might buy them uniforms. I think we buy, that's what this
Yeah.
is for.
You guys are lying.
Is to get their supply, their
Mhm.
uniforms.
We'll provide basic uniform outfitting usually, but they still on occasion will buy a portable radio or whatever they may need out their own funding.
Okay, so they're just doing this out of the goodness of their heart. We're not rewarding them in any way for helping out the sheriff's department.
For the most part. yes.
Public service is its own reward.
That's why we do it.
No, my good buddy Scott Griner, he loves doing the work because he gets to work Honeywell Center and meet lots of celebrities too.
4940. Commissary, shout out to that.
Do you have any reserve jail officers?
That's why the part-time funds, it's. The level of quality a candidate you get for like a part-time, or we've attempted, and then you call and I can't make it. I mean, it's just not worth. We go through too many steps and we can't get them to show up to even do the part-time work. That's why there's.
Are you still receiving them from Heartland?
Oh, yeah. Yeah. We have a handful of really good ones for the last year now and have worked out well.
Now, do you or Baker go to the schools? and they have-
Moving to weights and med, or does anybody have any other questions for Major Gannon?
A couple times.
Tyler, do you have anything for us? We're finished with your funds.
That's a pass-through account. Just so you know.
No, I don't have
So
anything else.
you put the money in commissary and just pay it back out?
Yeah, they
No,
bring
give
a,
it to him.
they bring a check from
And like-
commissary, we deposit it.
Location 26.
Why are you paying payroll?
Cause they can't pay payroll.
Yeah, that has to go through payments.
Thank you, Tyler.
No, sorry, took so long.
No changes here.
You love being there.
He's still here.
No, can't talk. If there, since there's no changes here, we'll go ahead and move to the highway department. I don't foresee needing to spend a lot of time here.
Does he got maintenance for building? Did we put that in there? For 600,000 or?
They're their own tax rated fund. They do have building maintenance in there. Well, they're not tax rated. They have their own income.
Gas tax really.
Gas tax.
That's tax, but this is
Iron tax, you know.
this is outside jump.
Right.
Yes.
But to today's point, if there's some projects at the, which commissioners know, first try to tap into his building maintenance fund, assuming he has any. To repair those buildings before CCD.
But not the insulation.
For the highway?
Not the what?
Oh,
We're
we're
doing
not.
highway.
I'm at the highway, I apologize.
Like the highway.
Oh, for Tyler, yeah, you can. answer.
Tyler can't have any.
I got Peter for you.
I have long johns.
Okay, so we're
On the old building, so-
Yes.
And they have a maintenance fund?
Right
A
now,
little bit,
Yeah.
a little bit.
Did not know that.
for
A little
now.
bit, 25,000. It goes a little bit. Wait,
25,000.
that's location 38. We had have location 39. Location 40. Um, 1173 is the restricted. Again, I know I'm going cruising through these, so stop me if you need to. 1134 covered bridge. And we're done. 1135 Cume Bridge. Do we have any adjustments here for you? Then, local road and street followed by lane mileage. EMA would be next at 31. And county general. With another asterisk.
Where are we? Where are we?
600.
Inch by inch, maybe. The county had, I would have gotten it, do you? It's okay. So didn't.
Didn't help us anyway.
Okay.
If there's nothing here,
She'll pick up on this, yes.
1152. 4951, skip through those. Okay, county health, 1159.
And they're moving funds, they're buying on their own too, right?
Red, pink, right?
Bye.
Right.
It's probably.
You said you are a quitter?
Yeah, Starbucks.
That's right, the Huntington.
It's.
But he just did.
Okay, I mean, it's income based, but.
Did he have any asterisks? You didn't check your asterisks?
I did not check into Matt
You just have one.
for,
Sorry, it's sorry.
Oh,
Okay, so we're good.
I do wanna say that as they do the budget, they do present to the health board.
Right.
Yes, they did.
And then the 1161 has to go to the state
This.
to get
This, but
Approved.
this.
approval
Before it comes here or after?
for.
This department.
They've already looked at 1161.
The part-time food inspector hasn't been used in 3 years, so 12304.
yeah. Subtract that.
That
Yep.
that has not been, and then. Oh. Doesn't. Book binding equipment. 30640 has not been used in 3 years.
Right.
Okay. 1161 would be the next for health first.
And this one has already gone to the state, right?
Yes, yes, this went to the state,
We don't,
so you guys basically look at the salaries and the state does theirs
State divides.
to meet the KPIs that they have required.
key performance indicators.
Sorry.
So the two legacy funds of 1168, 1206. Have been, will be, should be spent down to nothing.
Wait, is that the one that we fought for years for?
Yes.
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 Yes, I know.
Yeah, to apologize and everything.
Where?
You didn't give me a raise.
Yeah, you did.
That's fine. O2 auditor, please.
Spend all my money, sorry.
We've always something that can beat that.
Oh,
yeah.
Asterisk.
I had to buy
I'm
it,
sure she.
like checks twice this year.
Stop sending the checks.
We've looked at the 1170 already, with the bond payment is in there. For 2027, half of it is in there.
Did we just have the auditor up?
Yes.
Yes,
Yeah.
What did we decide to do about the computer program?
it's not in my budget,
Whose budget is it?
it's in CCD. It's, yeah,
I think we've policy wise decided to kind of move forward with Exoft, except for financials for now. That will be a savings. And then when Kelly's comfortable with Exoft financials, it'll be maybe a
I
little.
remember the discussion, I just didn't remember
Yeah,
what we ended up doing.
they're moving that direction.
And I just have not got verbal confirmation from the treasurer, and that's on me, so I will work on it. It's not on the treasurer either, it's just on me. So 1186 rainy day,
that's our standard
standard amount.
to pay out benefits.
You have the history of the riverboat fund, what came in and what,
Sheriff pension similar with, you know, they were getting money down south and they decided to split those. I forget.
no, I know what it is, I'm just saying, has it gone down?
Oh, historical balance.
I'm
amounts.
getting a deposit tomorrow for that.
I thought it
How much?
wasn't it only 50 a couple years ago?
Well, it's 40 next year,
Gambling is popular.
I guess it's.
I used to have a lot more balance in there.
Is that correct, Jeff? Everybody
I
used to
thought we
have
used to
three.
get more, that's what I'm saying.
I
I
think possibly
think
we
we
did until there's
used to
like a
get
senior, but
Yeah, more
maybe they paid the riverboat. I don't know.
They're planning on building that up.
Fort Wayne,
Well, not decided.
1193 would be the pension
Huh?
fund.
It's not decided, it's on the ballot.
1216 would be ineligible fund by the auditor.
Covered bridge tomorrow.
Better have a racetrack.
That's the big one.
hey, I do have, are the covered bridges insured?
1217.
What are you
Hey.
trying to say?
I can email
I
you
don't know
my
much for the
deadline.
Marston's.
J Cap.
We were just,
1233 would be jail lit with half our bond payment coming out.
We got $9,000 in training and travel mileage for elected officials. Are we gonna use that?
We are on track right now to use the entire 5,000 this year. We've had, the commissioners and I have attended a lot of things over the, AIC because of the new legislation, sorry. And plus the clerk,
Well, I went
recorder and all
to
that.
two, I just wondered where we were at with it.
when we, like, how much we've spent this year?
Yeah,
almost all of it.
Almost all of it, like,
okay. so
like the actual
we need to
4,000.
loan that.
Then lastly would be the 1237, 1238 opioid funds.
Wabash County is gonna get $78,292.
That's more than
Riverboat.
40,000.
Riverboat, he asked me how much the riverboat was.
So these accounts will have some health insurance being changed. Those numbers will go in there.
Yeah. I get it already.
I'm not gonna be able to fund the whole. Cause we only have 40,000. Because advertisement,
And will be additional.
so I would have to additionally appropriate. I mean, we can move that 40 up to the insurance right now. But before the end of the year, next year, I would have to appropriate. But I would if we wanted to award anything out of the restricted at that point too.
So I would just leave it as is if we want to reward, and then we'll make a health insurance adjustment once we know the numbers better.
And you can look down there.
We can do it all.
See the unrestricted, we have some room there.
Couldn't we, could you
See, I
change
question mark right
professional
here.
services and pick it?
That's what I was
Yes.
thinking.
I
You
can.
can't, it's
Because we
just,
can always additionally appropriate professional services as it arises.
that's fine. The committee was
Because-
considering continuing to, or gonna consider some awards yet.
And we have to come to you to get approval on them anyway, so
Okay,
we could additionally appropriate them
at that point.
at that award.
Okay, no, we don't have any current commitments that are gonna need.
We. Brian was the only one that we committed to. The other ones were like, we need more information.
So we'll let the auditor move that 40 up
Restricted.
in the restricted, and then we don't necessarily need to do it right this second.
Yeah, mine was. And then, do you want me to take the rest of it out of unrestricted?
After you review the numbers and everything, yeah.
We're gonna do building.
Okay, can you scroll to the bottom of the general fund, please?
Huh? Oh, yeah.
Last year, that's what we got. Gambling's up. Well, and it's based on this changes in the first 333,000 or whatever to go to certain.
Yeah, it's
Then they
currently.
distribute the rest.
It's the- So I'm gonna do it. This way. So we're currently at 1.1 remaining cuts.
That is with option two, three.
So I guess I have had some discussions with the auditor on a few things, but I'd like to talk about wages at this point.
Was,
Or what do you?
I'd like to leave it if at all possible, but didn't we have something we could move?
My,
I-
and I understand we want to leave them where they're at. I had a conversation with Kyle earlier. I'm concerned if we give the full 3%, we have cut a ton, like nickel and dime, a lot of different departments this year. Next year, if we leave the raise where it's at right now, are we going to be cutting staff? If we have to cut more next year, that's where are we gonna cut more from? I'm not against, like, I'm not saying we're giving zero, but I'm saying I'm a little nervous if we stay with the 3%. Cause I don't wanna have those conversations. Well, I don't want the commissioners to have those conversations next year if we don't have the funds to fund the full government.
Well, I get
That's my concern.
I have a question for the commissioners. Would you guys entertain a hiring freeze? Countywide?
You know, Huntington just did it, but they're a whole different.
I would be, except for positions that we have open now that we need to.
Right.
Yeah, we agree.
And any new, yeah, I'd be all right with that.
What positions do we have open?
BSO for one.
We have to fill that,
Yeah,
that's
we
not
gotta
a
go
choice.
that way.
It's a new house.
And hey, we still haven't.
What did you say?
We have to.
We still have some, we still have some.
So my
room in the
feeling is, I
commissioners.
think next year, I just think that we have had some economic development. We've got people moving here. I think our income tax revenue is gonna go up. That's my feeling. I mean, I see it. I do lots of taxes.
Yeah.
I mean, you can see the infrastructure going up. I think next year, it could be zero next year for them. I mean, that's the option. We give them the 3% this year. Next year, it could be zero. But I think we can make it work this year.
We'll know what the new lit.
And I think in Indianapolis, the hubbub about Indianapolis is they're gonna be making some more changes to our benefit, not our detriment.
Okay.
I mean, that's what I'm hearing. So I just,
So okay, so we're talking between 2% and 3%, you're talking what, 120 some thousand dollars?
127,000.
So how do we get to this one point? What are we rating?
Good options.
We could do a couple things here. We could change the cash flow, cash balance options. That said, I had a discussion with the auditor and what we have done in years past. It's not reflected in these numbers yet, but you can move county and city ambulance into it. We do it a one-time deal where you pay instead of out of the commissioners.
And that has the potential to be funded by the new lit rate.
Right, the new lit
The
rate.
new lit rate that is going to be, so it might not have to ever come back.
Right.
Really? So since we have,
To answer
Neil's here, so she's not
question.
gonna like me for this one, but to use the EDIT funds to pay Wabash City, pretty much,
For their
for their ambulances out of economic development and pay for those jobs out of our.
Well, those paramedics are gonna spend money locally, and I would call that economic development.
The other thing is, remember I said we've earned $1 million in interest so far this year? And we've a couple CDs, we're gonna probably earn, as long as the rates stay about where they are, probably another $1 million by the end of the year. And that's cash, that's not in the budget, but it does come back in our calculation,
It's in the.
cash on hand, yeah.
But we estimate that revenue at 85%. to be, so we'll have a little more.
Yeah.
But you're
If it
sure
stays
that
up.
you're confident Governor Braun's not gonna screw
I
this
don't,
up.
I think he's getting some land basing and I think.
I think he's doing an awful big job of trying to make himself look good. We get emails every single day about everything that's doing so great in our state.
Yeah, but.
If
He's trying to.
For
I
discussion-
think he's gotten some pushback from the legislators.
And that's fine. If
That's
you're
good.
confident in it, I trust your numbers.
if we were to go to remove that. From the county commissioners and then go back to cuts, because I believe it's already an option within eat it out of the cash balance.
I'm pretty sure we've had it there before anyways.
Yes, or insurance, one of the two we've had.
Yeah, I know.
It's been one of them that, or, yeah.
Can we cut the raises for all the boards, BZA, planning commission, commissioners, us?
We already did ours.
I know we did ours.
You know why? You're the lowest paid council
Yeah,
in this book.
okay.
Yeah, see, we're number one.
You know, I share Sam's concerns.
We'll-
We're way overdue for a market correction and, you know, nobody knows what that's gonna do to the interest rates. We got a pretty good idea what's gonna happen if you look back to 2000.
Yeah, but when you're looking at the BZA and the planning commission,
Well,
what I'm saying is they're not just, yes, Jeff and I sat on them. But it's not elected official. There's a lot of voluntary,
a lot of
community
time.
members that come in.
And they're all getting paid. All I said was taking away their raises. And just, you know, county hourly employees get their raises if we want to try and go to the three, it's a balancing act, but at the end of the day. I don't like getting into rainy day funds or any of these other funds or counting on interest rates. Cause, you know, I just asked them about a hiring freeze. I don't wanna have to lay people off. I don't want them or anybody to have to walk up to somebody and say, hey, you know. The department head has to walk up.
If we're keeping the raises for everyone else, we're keeping them for the board members.
That's fine. I just threw it out as a suggestion. I mean, we cut ours and we're.
And
the
it's gonna
lowest.
be pennies on the dollar.
When
When you're throwing that out, it's
Like
pennies.
I
versus-
said, you know, $5 at a time turns into 20, turns into 100. I guess what I'm saying is, what you said last night.
Yeah.
We've been pretty generous and the Senate Bill 1, you know, we can always be more you know, if Matt's prediction is right. I wanna go on the conservative side. If Matt's prediction is right,
Well,
if for next year, we can always do a catch up. But I really feel like this year, we need to be real careful, cause I don't trust them boys in Indianapolis any further than I can pick them up and throw
so. I'm an advocate for leaving it as is. So all of you can have we are there though, with what they've kind of changed. Because we wanna leave 600 to 700 there, because. Again, we're only using 85%. And last year we were what, $5?
$5.
And now, as we always ask, where's that gonna come from, that difference that?
Board support.
Okay, so we've got that,
We're good.
we're there now.
And we do all the levy calculations based on 85% of our net assessed values. So what it will do is it will lower our tax rate if we come under max levy.
So,
Which is a good thing.
so since we're at wages here, what's the majority consensus on the percentage?
For
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 employees of the
employees,
county,
yeah, just employees.
if we can give it to them, give it to them. And we cut a lot of other things.
Matt's convinced me.
I still.
With a face like that, how could you not give each things?
Right.
Silky smooth over there, my guy.
If we have to do this next year.
That's the thing, everybody, I mean, who's listening, who's here, if it's 0 next year, it's 0, I mean. We can do it this year, it's achievable this year, next year, it may not. be.
Are we in compliance in that Eden fund with the ambulance, like you,
Oh, yeah.
budget's 85 something, so you're, okay.
Okay.
I wanna make it happen, and we've done it before.
Yeah, insurance there or something.
He wants to see the 1 through 5 option thing.
I do like in the, always have like.
Can I-
Sometimes it's hard to see up there and like, I can get you the printed version. Add the printed version.
You can go online for that. Got it?
So we're currently on.
While you're looking, I think it's a twist,
Yes, Jeff?
and I don't know whether this can be done, but if you don't wanna take a raise, take it, donate it to a charity of your choice, cause I'm afraid down the road, we're gonna be so far out of line.
I don't do it for the money.
I didn't even know.
I mean,
Don't, what if somebody,
is that really gonna detract? It's not worth the money. I mean.
Amen.
no, but somebody's gonna come behind you that needs to be, that's gonna run and.
Well, they're just gonna run for the money.
If they're running for the money, they're doing it their.
But
6,000.
Trying to get people to not run against you, they'll get paid.
I get it, I mean.
I just said it out.
Just saying, looking at this, the way you study that we pay for, you guys are low.
Yeah, that's fine.
Next year, employees all zero, we will be 100%, 25%. I'm being facetious.
On record.
Well, I don't know what changed, but last night it looked like there was a majority at 2, and now all of a sudden it's 3.
That was 3 last month. I mean,
So,
Like I said.
Well, that was before we moved some stuff around though too.
It doesn't have a
It's-
service or anything.
We're gonna do it. I mean, I'm in favor of doing it this year, but next year, like I said, we gotta see what happens.
And we're gonna.
Huh?
Is this-
That's exactly what I said. But
How does
we
this
got the
come
numbers to
with
work,
the
so
judges people?
if the numbers.
we left theirs in.
We decided it, right? That was. Yeah,
Next year, we won't have that issue, I don't think.
okay.
Before we adjourn here, those dedicated souls out there, do you have anything further? Tyler?
No, I don't think you didn't pay attention to it. You guys over the
Instead of that.
Axon contract, was it,
Oh, yes, it's in there.
okay, but was there some other,
I think it's a.
we're good for 5 years?
Well,
Oh.
look for next year.
The contract would need to reflect, depending upon
Yeah.
duration, like a government contract has to reflect.
And they're used to that.
Yeah.
They're used to that.
Yeah. I mean.
Yeah, so what Dave was talking about was maybe bring it into this year to get 1 year covered with cash. But then we talked about, well, you want it for 5 years, starting next year, so.
Yeah, that's what I was talking about.
Yeah, he had mentioned that, yeah, no, it's in there for next year.
Thank you very much.
I knew there was 2 things we were doing this year. I thought it was the cameras in the van. It was the guns in the van.
Yeah, now, the Axon, like I said, it's extremely significant,
Yeah.
it is, so. And we don't like it either necessarily, but it's invaluable at this point, law enforcement.
I guess I want to see more videos of.
I do have a question for it.
It doesn't affect, I've seen videos where guys, it doesn't affect.
On occasion.
I wanna say you guys
Yeah.
all
They're
got
in
an
a lot of
invite to throw Wabash County's annual dinner.
Yeah.
Let me know if you
10,000.
to attend.
I did see Gaunt Sun got
You guys just
the
new box cameras
employee.
like so?
No, that's ag dinner, wrong dinner.
Oh, dang. What's the
This
food
is the annual
service?
The
dinner.
business of the chooses that.
Huh?
There might have been.
They get a
upgrades.
And that was where we cushion it. I'm not trying to change this. What I'm just saying is if you got them,
It's on.
it'll work with this system.
Kimberly, do you have anything for us this evening?
Other departments.
Else?
Yeah.
Yeah.
We're glad we got to see you today.
Don't forget to say that.
And-
Chester.
And when they started asking questions, you had the answers to
I
this.
think part of the program-
That'd be better than hanging out there.
It has to be.
Yeah, it's gotta be better than hanging out there.
Okay, council, bring this.
You guys just got new body cameras recently. Yeah.
Motion to adjourn.
No, I'm not entertaining that much.
It'll just be a soft day.
You wanna go?
Is there?
But we'll get car cameras.
It has liquid, right? Council, we need a motion to advise and direct the auditor to prepare an ordinance regarding the budget that's been prepared. Is there a motion to do so?
So
moved.
Or Sam, move it and I'll second
And a second by Mr. Mize. All those in favor, raise your right hand. We're advising to just prepare the budget.
Okay, yeah.
Prepare the budget.
We'll have a
Pretty.
Okay.
Just that-
And if those saying no? Those abstaining? Motion passes 6-0 to 1 for the preparation of the ordinance of that regarding the budget. Thank you.
Motion to adjourn.
Thank you.
Well, sorry, he had this.
John, I know it's past your bedtime, but.
It is.
Also, that's my business.
Sorry, Nick, I didn't mean to shut you down for a time. I didn't need you guys to.
Yeah.